Good morning, Madam Administrator. Let me know when you're all set. Thank you.
Oh, good
So,
morning.
good morning. We're going to have a public hearing on a number of bills today. We have 54 people testifying, I do believe. So we're going to start with Helen Sullivan. Helen, are you here?
I sure am.
All right, the floor is yours.
Thank you. Thank you, Senator Austin, Rep. Walker, and members of the Appropriations Committee. I'm the administrator for the Teachers Retirement Board and just wanted to define what we have requested in our legislative package. To start and summarize, under our definitions, we are hoping to sunset Hamden's Children's Center as they are not a governmental entity and are not eligible to participate in TRB. We are also commencing and verifying our once a benefit is established and a member starts to receive a benefit, it is irrevocable. We made a slight modification under our death benefits. It was a little outdated. If there is no beneficiary, we would like to have the spouse or children be able to accept those, get a lump sum payment on teachers' contributions or members' contributions that remain should they pass away. We are also requesting that we can sync up the elections. Last year, there was 2 additional members, board members added to our board of directors. That election took place in October. Generally, they have always been done in July. So we would just like to align that October date back to July so that we are not paying for 2 separate elections, one in October and one in July. And then lastly, under section 61A, educational technology, we'd like to remove the teachers retirement board has an option for retirement. The position is not affiliated with the TRS system. So that's it in a nutshell.
All right, Helen, does anybody have any questions for the Teachers Retirement Board executive? Well, that's all we have, Helen. Thank you so much.
That's great. Everyone have a great day. Thank you.
Up next is Representative Howard. Representative Howard.
Good morning, Senator. Excuse me.
Good
Thank you for having me. Good morning, Representative Walker, Senator Berthel, Representative Nuccio, I'm sure is tuned in. I hope she's doing well. Thanks for having me this morning. I want to stop in quickly to call your attention to a bill on your agenda today, House Bill 5090. There is, I believe, a clerical error in that. It should be 1,017,000. That's an allocation to CCSU through DESP to create a science training lab at CCSU, and it's modeled after a program in Rhode Island. As you know, in my full-time job, I'm a detective. Back in 2016, I was fortunate to attend the class at the University of Rhode Island, what they call the BCI School, or Scientific Evidence School, by nature of my close proximity to Rhode Island where I work. I should tell you, just this morning, the Stonington Police Department was notified that the 2 spots that they had reserved in that particular class to address attrition in their investigative units have been taken from them in favor of Rhode Island students who have applied because they prioritize Rhode Island. In Connecticut right now, the clearance rate of our crimes has gone down significantly. Whereas we used to solve an average of 23% of crimes, we're down to 16%. There's a lot of reasons for that, but not the least of which is the attrition that we've seen in law enforcement over the last several years that has led to a lot of senior experienced individuals leaving the profession, and we're sort of thrusting a bunch of newer individuals into these investigative roles. The state lab that we have in Meriden is a state-of-the-art, phenomenal job. But where we fall short in this state is training the practitioners on the scene to get that sort of good scientific evidence to the lab. Most recently, just a couple of weeks ago, we approved independently House and Joint resolutions for a $25 million allocation to pay back individuals who are wrongfully incarcerated due to police work not being done appropriately. This class, if we can get it through, not only will lead to more crimes being solved, it'll lead to less people being wrongfully accused and save the state substantial money when those wrongful suits come forward, as they did in this particular case. And I just want to mention that this is a collaborative effort that's been going on for over a year now, where the prior commissioner, and I know the new commissioner of public safety has met with CCSU as well, but the prior commissioner, the leadership in the public safety committee and police chiefs have toured the URI campus more than once, as well as the CCSU campus. And CCSU has submitted testimony in favor of this. They are in support of it. They are poised and ready to take this on. And I should tell you, the $1 million allocation also includes $100,000 in scholarship grants, so that municipalities, for the first several officers going through, will not bear the cost on their municipal budget. It would be covered in that allocation. Lastly, I just want to point out that a similar bill has already been JF'd out of public safety, Senate Bill 1038, which it reads exactly as your bill does, and got unanimous support in the Public Safety Committee. So I wanted to call that to your attention, and I am here to answer any questions.
Thank you, Representative Howard. Are there any questions for the representative? Go ahead, Representative McCarty.
Thank you very much, Madam Chair. And I know it's just not to ask a question, but I wanted to recognize Representative Howard for bringing this forward. I don't think we have any this type of training, do we, currently in Connecticut?
No, ma'am. In fact, two of the towns I represent, Stonington and Ledyard, in the past several years have had to, at a more substantial cost than would be in Connecticut, had to send their officers to Rhode Island. And not only are the municipalities paying more, but that money is now leaving our state, right? So in going forward, and I should say this is anticipated to be a one-time expenditure to get their equipment, and I can provide this committee with the breakdown of costs and also the syllabus from Rhode Island that this will be modeled after, if you'd like that. But going forward, because it's a one-time cost, in the future, municipalities will pay a small tuition to send their officers through as they choose. This is not a mandate, but that will be available to them going forward. But the first several will go through without that municipal burden, because we've allocated $100,000 in scholarships in this appropriation. Should you all decide to move it forward.
Thank you very much, Representative Howard, and for your leadership on this issue. Thank you.
Thank you.
Thank you, Representative Walker.
Thank you, Madam Chair, and thank you, Representative Howard, for bringing our attention to this. I just will say that Senator Austin and I saw this need last year, and we put money in the ARPA budget of $200,000 that we designated to DESP to try and help work on recruitment from high schools or from colleges. And we've sat down and talked with the new commissioner, and he's very excited about knowing that he has a resource. So we look forward to having the two things merged together so that we get a more robust group of potential police officers that we can share around the state. So thank you very much.
Thank you so much, Madam Chair. I appreciate it.
Are there any other questions or comments? Seeing none, you're all set, sir. Have a nice
Thank you, ma'am. Have a nice weekend, everybody.
Yeah.
Up next is Sarah Egan, Child Advocate. Sarah?
Good morning to the, house is very low. Sorry.
What happened?
It's a
Short people have
It's a
problems.
horizontal challenge. Sorry, I had to switch chairs. Good morning to the committee. My name is Sarah Egan. I run the state's Office of the Child Advocate. Wanted to offer brief testimony to the committee on two bills. The first, 5428, an act requiring DCF to report on program utilization, which I think is really helpful because the more data they can provide on contract utilization, it helps inform appropriation decisions. I'd like to respectfully offer a couple additional recommendations to the committee for your consideration, that as you look at utilization, there's an opportunity to also look at any declines in utilization and an explanation for any declines in that, and whether it's attributed to decreased need or a smaller workforce for each contracted service. Whether the family has to be in DCF's care or custody is a criteria for referral or admission. Identifying the geographic scope of each service contract. It's my understanding that the scope gets larger and larger, which makes it challenging to serve populations. And achievement of contract outcomes, which they used to report on publicly on a website, but that stopped around 2017 or 18. So I'm happy to provide some language in writing for the committee to look at if you thought that would be helpful. The second bill I wanted to offer testimony on is an act concerning, raise Bill 50, an act concerning exclusion of aid to distressed municipalities from the spending cap. And just, we of course understand the reasons for the cap and the structures that are in place. We would urge wherever there's an opportunity to identify the bounds of flexibility under the cap and what it means. We understand that there's an exception under the cap for the state's compliance with federal mandates, though I don't know what the outer bounds of that means. And what we wanted to just raise with the committee is that there are federal mandates that apply to vulnerable children that the state is not in compliance with, I think rather inarguably. And two, I wanted to highlight is special education mandates under IDEA as an example. The state has a widely known labor shortage in special education. Our office, in conjunction with Disability Rights Connecticut, just put out 2 days ago an investigative report that looked at a major provider of special education services to children with disabilities and found that over a 3-year period, half of the teachers in that program lacked certification to teach, and that there were classrooms with children with autism that had no credentialed teacher in the classroom at all, unbeknownst to parents. So addressing that is a mandate under federal law. The second mandate I wanted to identify is Medicaid. And under Medicaid, as you, I'm sure, well know, children have a broad entitlement under early periodic screening, diagnosis, and treatment mandates, the EPSDT mandate under Medicaid, which requires that states identify, screen, refer, connect, and ensure reasonable access to children to medically necessary services, whether or not that service is covered for adults. So we have overwhelming data in the state developed by the state agencies and Caroline that we have a serious problem around access. And I'll just give you one example. In the first 3 quarters of 2023, the ASO for the state agencies, Caroline, reported that there were over 1,200 children identified as stuck in local emergency departments for behavioral health reasons. And that means stuck after being cleared for discharge. Over 400 of those children stayed stuck for 4 or more days. And the connection to care rates for those children leaving emergency departments at the 7-day mark was around 30%, and at the 30-day mark was only around 40%, which means that we know children are in the EDs and stuck because they can't access care. And we know that when they're discharged from the EDs, they're still not accessing care at a reasonable rate. So I just wanted to bring that to the attention of the committee. I know these are challenging budget issues, but these are federal entitlements for children, particularly children in need and children with disabilities. So just wanted to bring that for your consideration. Thank you very much.
Thank you, Sarah. A couple things. One, relative to the distressed municipalities, I want everybody to know that even if we move distressed municipalities out from under the cap, we have to rebase, which is not going to give us any room under the cap. It may in the future, should we be able to put money into distressed municipalities, help out that way. But that would come in conjunction with us getting more funds to put into distressed municipalities in future budget years. But we would have to rebase, meaning that any money that we took out, we would take off of the spending cap. So it doesn't give us any room under the spending cap. So I wanted people to understand that, because when we moved it under the spending cap, I know Robin's there, and I should just move over a bit. The fact is that when we moved it under the spending cap, we rebased it and added money into the cap giving us the room to move it under. If we go back and move it out, we have to take money out from the spending cap. So we have to rebase the formula to do that. And we all know that the governor is really not in favor of having things out of the spending cap, out from under the spending cap, or in a fund that is not appropriated. So that is a much harder discussion to have. Relative to your report on special education and other groups that handle children that are special needs. We have done reports before saying that looking at the issue of special education. I put a bill in myself every year on getting cameras in transportation for special education kids, which doesn't happen right now. And cameras are a lot cheaper than they used to be and a lot more effective than they used to be. But problems with special education kids are really, they're robust problems because no one wants to believe that special education child. They don't want to believe that there's a problem at their school. They don't want to believe that there's a problem with their driver. They don't want to listen because they think in many ways that the children are not being truthful. So I think that us having some control over special education services and special education transportation, in the case that got me interested in this, the young girl was molested by a driver, and it took multiple times before anybody would believe the child. And since that time frame, I've not been able to convince people that we should mandate cameras on transportation for special education children. And I think that's something that we need to look at, and programs for special education children need to have oversight. And as hard as that is, the State Department of Education has to figure out a way for them to have oversight and review of this, because this is a well-known problem with special education programs across this country. And we spend a lot of money on special education, and I don't know that it's always well spent. I think that a lot of times those kids are not getting the services that they need. And, you know, I think that that's a huge problem for us as a state. And the programs that we should be paying for should provide those children with a chance. And that's the design of it. And they're not getting a chance if they're being abused, if they're being mistreated, if they're being ignored. All of the above are things that we really need to pay attention to. So thank you for your comments, Representative Walker.
Thank you, Madam Chair, and thank you, Sarah, for your testimony. I'll go to the utilization bill. I'm glad you brought up a lot of those points. Part of the thing that really has perplexed us, well, in some of our budget hearings, Department of Children and Families came and testified, and we talked about wait lists, and we talked about volunteer services. And one of the things that they said was that we don't have any real wait lists.
Right.
And I mean, and then that night we had testimony after testimony after testimony from family members that said, I'm on a wait list because I can't get services for my child. I think that we need to look at how are we defining a need for the programs, and are we using the descriptions necessary for referrals? Because then they also identify the fact that they will find some sort of service to be connected to the parents, I mean, to the child, but it doesn't necessarily mean that that was Carolyn's first choice. And we saw that with the Star Home when we had the hearings on the Star Home. So to us, I think utilization has to be much more transparent. And in order to do that, we have, and you brought up a good point, we have a smaller workforce because our nonprofits are not getting the money that they need to do the services. So they're disappearing. I just want to ask you, in doing in taking the utilization issue a step further, should we then also make it necessary for like DDS and some of the other agencies that are working with the populations? Because again, many of the kids that are in the criminal justice system have a learning disability that has never been identified. And therefore, are we providing everybody with the opportunity to make that identification, especially with your special ed population in the schools, so they kind of all blend together? I don't know if you have any comments on.
Yeah, so one of the suggestions that I would make, Representative Walker, is it is hard to get at that wait list issue for that reason, right? So we know like the enhanced care clinics can't carry a wait list right. And then other programs that we have are slot based. So you either have a slot or you don't have a slot. And if the family is referred, let's say to MST, multisystemic therapy, and there's no slot, they get referred somewhere else, but it may not be the right service. And I think, and again, I don't know what data the agencies have at their fingertips, but maybe it's possible to have them provide information. I mean, you want the utilization data, you want to know where it falls from the contracted amount. So our recommendation would be anything that falls below 85% of contracted utilization, why, right? I'll give you one example on that. So family-based recovery is one of the state's only intensive in-home services for parents with a substance use disorder and a young child. Right. And that's a DCF contracted program. We have a massive caregiver substance use challenge, right? That has massive multi-generational impact on children, right? We have a handful of programs like FBR. So when we look at FBR, we know that DCF
I'm
recently.
sorry, could you say what FDR is?
Family-based recovery.
Thank you, because we are all in the same fishbowl.
So it's the trend line for utilization for family-based recovery is going down, right? So the number of referrals has gone down and the utilization has gone down. And for the last fiscal year, DCF recently reported that the contracted rate was about 42%. Utilization was 42% of the contracted expectation. But we need to know why, right? It can't be because the need is lower, because we know that's not true. Right, because we still have 1,300 to 1,400 adults every year that die from substance use disorder. So, so we need to get underneath that. And part of the way we get, we could ask, right? So how much of that is attributed to a decline in referrals, and how much is it attributed to referrals that are rejected or declined by the provider? And what is the reason, right? Is the reason due to workforce capacity, or are referrals down? We don't know, right? For the other point that you raised, perhaps asking the departments for data around referral and match, right? So how many referrals are going unmatched, or I don't know what the terminology, each agency might use different terminology, but how many referrals go either unmatched or deferred, and what is the reason for that, right? So in other words, if a family in Southeastern Connecticut goes to whomever and needs multidimensional family therapy, or MDFT. I know there's a provider in that neck of the woods that recently told us they turn away 2 to 3 families a week, right? That's not going to show up on a wait list, but it will show up in a referral, in an unmet referral, right? So I think that's the data that we need, is how many referrals go unmet? What are the categories of need that represents? Because then that'll tell you where the gaps are.
Thank you. Yeah, I agree with you. And I just thought about the other agency, Office of Early Childhood. What they were saying is they don't have a wait list, but what happens is they take the names and move the names off of the application list to another list. So I guess there is a nuance going on with the agencies so that they don't have to define wait list. They just say, well, we're working with the families, but we're right now, the services that we have that are available are not necessarily the ones that they applied for. So it's kind of semantics, but meanwhile, our children and our families are drowning. And so we've got to do a better job in trying to figure out what services we need and how we're going to get them to the families that need it. Thank you. Thank you, Madam Chair.
You're welcome. Can I just make one other point about that, is that it also intersects the point that we made about Medicaid, right? And non-compliance with EPSDT. It intersects there, right? Because the state right now has a lot of data on size of networks. If you said, well, how many kids are served receiving ABA services covered by Medicaid? You know, Carolina DSS could tell you, well, this is how much our network has grown, and this is how much we pay per member, and this is where our spending is going. But they can't give you the wait list data for those kids, right? And so that compounds, like, how do we measure our compliance or lack thereof with those EPSDT mandates without the wait list data?
Thank you.
Thank you. Are there any other comments or questions? Representative McCarty?
Thank you very much, Madam Chair, and welcome, Sarah. It's always good to see you. In the testimony on 5428, the commissioner makes the recommendation that program utilization should be extended out. And hearing what you're saying today and all the different facets of the utilization and the reasons, do you agree that the report, because I think it's listed that it should be submitted by July 2024?
Oh, that I don't know the answer to that. I think it's a good question. Like, I think it
Yeah.
depends on how quickly they could compile that data. I don't know. So I would defer to, I think it's a fair question, but I would defer to the committee, to committee's judgment on that.
But we want to be sure that we do a thorough investigation. And thank you for all of your work. You did mention, and I hope I heard this correctly, that, you know, talking about the bill on the distressed municipalities from the spending cap, but you mentioned that there are certain areas that really we are compelled to look at that may be federally mandated. And you talked and you gave us the special education. Do you have other mandates that you think that, well, I'm sure there's more to come, but if you could give us a sense, and I couldn't find your testimony, but did you submit it so I can look at it?
was late.
Okay, that's fine.
I'll
Just
get it
I
to you.
always
Thanks.
appreciate very much your insight and all the
you.
work that your office does. So I'll look for that and we can resume, because I do think it's important for the state to be in compliance with those mandates. Not necessarily moving this cap, but, and then to to Chairman Austin, just so you're aware, the Education Committee has a special ed task force in place, and appreciate your comments. I know many districts do have cameras, but I always listen, and we're trying to do our best to address all of those concerns. So just wanted to put you at ease that there is work going on in special ed.
And
So
And Representative Bacardi, we'll get you that testimony, and we'll be actually presenting to the Special Education Task Force on some of our findings. And I couldn't agree more with the comments that Senator Austin made, which are so important about how we ensure delivery of not only quality special education, but safe special education to some of our most vulnerable students. And we have a long way to go. And we don't have cameras on buses, and all buses, and we should. And even when they're there, there's nobody reviewing them. And we don't have them in classrooms for multiply disabled children, many of whom are communication impaired. And children, not when they speak up, may not be believed, but most children do not speak up. And if they speak up and they're not believed, they may never speak up again. And we too have seen the horror stories about abuse and seen them and learned about them. So I just really wanted to echo those comments, because I think that in all honesty, I think that our safety net for these children is tissue paper thin, and that's not good enough.
And I agree with you 100%. And I think that this task force, that we want to be assured that we're addressing all of those concerns to the utmost. So I think it'll be a high priority.
And thank you,
Thank you
Representative.
so much for all of your work, Sarah.
Thank you.
Thank you. And while everybody's looking for ways to get more money to special education, I would remind you, IDEA is federally mandated, and IDEA committed 40% of special education costs would come from the federal government, and we're getting about 6 or 7% right now. If we got 40% of special education costs from the federal government, as we are mandated to get, that would allow us to provide services in a much more effective fashion. Up next is Representative Johnson, followed by Representative Osborne.
Uh, Thank you so much, Madam Chair, and thank you so much, Sarah, for your testimony and your work. I'm very, very interested in seeing all the information you have with respect to the things that are mandated that we're not following through on it, particularly with the Medicaid program, but also when we take a look at special education. I've been looking at the funding and the convoluted system that we have in this state for providing coverage from the state to the local municipalities. And it started in the 70s where we created this 4.5 times the pupil cost that then gets transferred over to the state, supposedly at 80%, but never quite ever makes it to 80% for the excess cost. And then the balance is paid by the towns. And this transfer occurred even more so when we went on the good effort to create the group homes and transfer students from the training schools in the 90s to the local communities and put them in the local boards of education's responsibilities. So we haven't changed that or addressed that all this time. Plus, at the same time, we know more about how students can learn. We know more about what they need to make sure they function well in society. And we have not been able to apply that. And if you could just speak a little bit to the fact of the transfer of the cost from the state to the local municipalities for special education and why perhaps it's limiting access to these situations for students, particularly in the communities that are called distressed, but I call them serving communities.
Well, we certainly hear about that a lot, Representative Johnson, and the challenge to local communities when who are obligated to educate all children within their bounds. And I spent many years representing children in DCF care and had a lot of tugs of war about who was responsible to educate a child with particularly complex needs, right? And so finding a way to do that more efficiently from a state level, I think is going to be really important and really appreciated by local municipalities. I did wanted to point out that while I completely agree that special education is underfunded, right? I referenced the report that OCA just put out with Disability Rights Connecticut about services in a state-approved private special education program, one of the largest in the state. Connecticut is the national leader in outplacing children to private special education programs. We do that more than any other state in the country. And that costs a lot of money. And the majority of children who are placed out of their school districts are actually children of color in Connecticut. Mostly who have been identified as children with emotional disturbance. And Senator Austin referenced oversight. And I think that is a key because we both don't have enough money and then we spend a lot of money. And these children, some of whom may be very well served, but as we just documented in one of the state's largest programs, were dramatically underserved, dramatically, and on the public's dime and on the public's watch, right? From a range of $220 a day to $550 a day. And who does that program serve? 70% children of color, mostly boys, all children with disabilities. So it is an equity issue, right? It is an equity issue, and that's its own mandate, right? So I really appreciate your focus on that. And I've long thought that equity is partially about funding, but it is equally about monitoring and enforcement. And until we fix that part of the system, the kids at the bottom, we know who the kids at the bottom of that totem pole are always going to be. Low-income children of color with disabilities. And that we have to fix.
Thank you so much for that analysis. I really, really appreciate it. Thank you, Madam Chair.
Up next is Representative Osborne.
Thank you, Madam Chair, and thank you, Sarah, for your testimony today, and thank you for being here to shed light on these subjects. I'm particularly interested in your testimony about Raise Bill 5428, which involves the study of utilization, program utilization rates by DCF. And one of the questions that comes to my mind, because my experience is solely with families who are already court involved, right? Families who are already at juvenile court. So that families' needs have, or issues have risen to a level of court involvement, which is much more serious than families who are DCF involved prior to court involvement. So I'm wondering if that study that we're talking about, and if the numbers that we currently have from DCF about utilization rates, do they differentiate between court involved and non-court involved program utilization?
That's a great question. I don't know I don't know whether they have capacity to differentiate. I mean, I think it's a really good question, and I think it's worth asking the agency if they can dissect it and disaggregate it in that way. My guess is going to be no, but I don't know that for sure.
Because when I think about program utilization by the clients and the families whom I worked with while they were court involved, there were varying levels of motivation. Much of it is mandated involvement at that point. If you don't go, you won't achieve this level of contact with your children, or there will not be an opportunity to potentially reunify with your children. So I think that it's not just about the utilization, but why are people referred to the program to begin with? And are there certain numbers of slots that have to be held open for court mandated involvement? And in addition to program utilization, I think a factor of it, and maybe this is just a longer conversation you and I can have another time, but what is the program utilization efficacy?
Right.
You know, are people not motivated to show up? Does a number that says there's non-utilization include people who are referred and engaged but aren't actually showing up? Are they not motivated to do so because the programs aren't effective? You know, there are MDFT is normally a fabulous program, you know, I do know some non-court involved families involved in MDFT, and it has had great, you know, real effective returns, but there are other programs that are not so much that way. So is utilization tied to effectiveness?
Right. I think it's I think it's one of the most important things to determine. And I think that certainly speaking for what I've seen from the department, they do have a lot of that information, right? Because they have QA mandates around their contracted programs. So for example, and I won't name the program and call it out right here, but one of the programs that we looked at, which is a program for parents with substance use disorders and their children. And we look at utilization. We also look at outcomes, and the department is able to provide us the data that we request, which is how many referrals are accepted by the community provider, how many of the families stay with the service for the duration of the 6-month, 12-month recommended level of care, how many drop out and why.
Right. Are there
Right.
barriers to transportation? Transportation for attendance at that program?
Right. I mean, and so they are able to, for some of the programs, they can drill down a fair amount. So why do people not finish, and what percentage complete with treatment goals? So for one of the programs that I'm talking about, what we were able to discern from the data is that of the families referred, only about a third actually complete the service and met treatment goals. Now, what does that mean? Does that mean the program doesn't work? Does it mean other conditions make that hard? But it is important to ask those questions so that we know, so that we can then ask the next question, right? Which is why, and is this program effective? And are you getting what you need from it with the dollars that you're spending? And I do think that they have a fair amount of that data for the programs.
You know, just an observation is that these are, you know, I think these are basic questions that our departments should be, whether it's DCF or any other provider of a public benefit like this, any of our agencies should be able to identify the efficacy of the programs, the utilization rates, the why is there or is there not efficacy or involvement. And if our agencies don't have the capacity to report that information to us, then I really think that some of the funding that is not being used for the programs that are not being used, some basic, you know, Lean Six Sigma, you know, efficiency standards should be implemented. Some studies, some basic governance, effective management.
All set, Representative?
Yes, thank you.
So we're getting into policy. So any other questions? Representative Chalesky?
Thank you, Madam Chair. And to the special education funding, just in briefly looking at what some other states might do, it appears that Massachusetts has a cap to the amount that private providers can be paid for outplacements. So are you aware of that or any other states having a cap?
I did not know that about Massachusetts. I know that's something that folks have talked about here. And I know the legislature tasked, I believe, the auditors of public accounts a few years back with looking at a series of things related to expenditures with state approved privates. And one of the things folk talks about is whether there should be sort of a fee schedule. I don't think that was adopted. And I think there are pros and cons to that approach. And so I don't know the answer to your question. I think it's worth looking at, but some of the programs, I mean, a lot of times you get what you pay for too, right? And so some of the, my experience with some of the programs has been very positive, right? And with others hasn't been. So I do think that the oversight of how those funds are expended, both by the local school district and the State Department of Education, and perhaps by the auditors of public accounts again, is a key here.
Thank you for that. Thank you, Madam Chair.
Thank you. Any other comments or questions? Let me see. You're all set?
Thank you.
Thank you. Up next is Colleen Murphy. Turn on the microphone.
Good morning.
There you go.
Senator Austin, Representative Walker, and members of the Appropriations Committee. I'm Colleen Murphy, the Executive Director and General Counsel of the FOI Commission. Thanks for the opportunity to testify very briefly today on House Bill 5047, an act implementing the governor's recommendations for general government. I'm a little surprised to be here. It's odd to testify before this committee on a non-budgetary matter. But within this bill is a proposal that contains quite a weighty legal issue affecting public access under the FOI Act. But not to worry, I'll try to make this quick. We've submitted more detailed written testimony on it. The FOI Commission opposes Section 24 of the bill, which seeks to add a new exemption to the disclosure of public records, apparently in response to a Connecticut Supreme Court ruling. The ruling ordered the disclosure of police reports absent personally identifiable information about untimely patient deaths in 2016 at Whiting Forensic Hospital. Specifically, the death of the inmate whose demise was originally recorded as a medical event, but reportedly was the result of choking due to an unobstructed airway while the patient was restrained. In that case, the Supreme Court here in Connecticut followed the lead of courts across the country and concluded that the privacy rule under HIPAA expressly yields to state laws such as the FOI Act that otherwise control the disclosure of public records. The court quoted from commentary on the privacy rule that stated, "We intend this provision to preserve access to information considered important enough by state or federal authorities to require its disclosure under law." In the bill before you, Section 24 would exempt records maintained or kept on file by a public agency that is a covered entity as defined in 45 CFR 160.103 and that contain protected health information. That is a reference to HIPAA and the privacy rule. The wording is awkward, but it essentially aims to import HIPAA into the FOI Act in contravention of the reasoning of our Supreme Court and held universally by other state courts that have reviewed the issue. We urge you to reject Section 24 for two reasons. One, we don't believe it belongs in this budget bill. And second, because it would contradict our Supreme Court, courts across the country, and it would shield information from the public about occurrences in state-run facilities and beyond. That concludes my testimony. I'm happy to answer any questions you might have.
So thank you very much for coming, Colleen. And I was equally concerned. And the bill number that this is referencing is 5047.
That's correct.
And so it's the governor's implementer bill for the general government budget.
Right.
But I'm very worried that we continue to attack the FOIA by minimizing its requirements for open and transparent government. And so I take what you're saying to heart. I think we need to take a step back and realize that what was happening at Whiting, if it had not been available for public view, would have continued. And what happens in a lot of areas without access through FOIA on many government programs, we would not be able to track the problems that are going on and correct those problems. I personally take to heart what you're saying, and will work to see that that section is removed from a budget bill that has nothing to do with access to information. So I appreciate your comments. Is there any other comments or Representative McCarty?
Thank you, Madam Chair. And just for clarification, so the FOI is saying that they could still maintain the privacy of the individual, but change the language in section 24. Am I hearing that correctly?
Under the court ruling, personally identifiable information was protected. And the reason for that is there are, under our laws in the state, there are various rules on confidentiality for patients, doctor-patient privilege, psychiatric privilege. So we feel Section 24 is really unnecessary and would cause, quite a widespread ripple effect, not just in Connecticut, but elsewhere, because courts across the country have ruled this way, that HIPAA is very important. But if a state law requires disclosure, then HIPAA must yield to that.
Okay. Thank you for that clarification. Thank you.
Thank you. Are there any other comments or questions?
Thank you very much. Appreciate your remarks, Senator Austin.
Thank you. Up next is Representative Hughes.
Hi, Madam Chair and my esteemed members of the Appropriations Committee. My name is Ann Hughes, State Representative for the 135th, and I'm here to testify in strong support of SB 50, excluding aid to distressed municipalities outside of the spending cap. Now, I did hear you, Chairwoman Austin, and the reason that I support this is that so we can figure out a fiscally responsible way that within the spending cap to address these early childhood care, higher ed, nonprofit, state contracted services that are collapsing because of lack of funding. And I know that this alone won't solve it, but I think along with our tax justice revenue bills, we can be creative and flexible and fiscally responsible to meet the urgent obligation to services to our youngest, to our elders, to our most vulnerable communities. And this SB 50 is a piece of that solution. And I want to be cognizant of what you said about rebasing the municipal aid and figuring out a way to meet the workforce capacity provider demand while within the spending cap. So I'm looking at raising revenue, ways to be flexible so that we can meet these urgent demands. And I urge you to consider this as a piece of the solution.
Thank you very much. And I want to remind people that last year we added in $900 million in new spending in both year one and year two of the budget. So it's not like we were starving the budget on all levels. We added in an additional $900 million in both years of the budget. So I think that when we have these discussions, we have to talk about the facts that are in front of us. So I appreciate your comments, Representative Hughes. Representative Johnson has some comments or questions.
Thank you so much, Representative Hughes, for your support of Senate Bill 50. My concern has to do with the fact that our Medicaid providers, the analysis hasn't been done for, in some cases, 15 to 20 years in terms of how we're underfunding Medicaid providers and how we're leaving out children in terms of their access to care. And we're not able to hire providers because of the fact that we haven't been analyzing exactly where we are with respect to the funding for the children, whether it's for birth to 3, early childhood, or special education. And so I just wondered if you had any other remarks regarding those issues.
Well, you sit on Human Services, so we've been hearing that, and we've been hearing from the Office of Child Advocate exactly this crisis of care. And that's why we're trying to look at ways we can raise the Medicaid reimbursement rate, which will also come before this committee, so that we're not leaving federal dollars on the table. And I heard that around the special ed costs too, that we are leaving dollars on the table. Federal dollars, well, we're not leaving them. They're not giving it to us. But there's got to be some more accountable ways of funding these urgent services, that some of which we are mandated to provide, and we just don't have the providers in our care nonprofit system, which we are state contracted services, by the way, are collapsing because of lack of funding. So I appreciate that we did put 900 million in, but we didn't make up for 20 years of not adjusting our Medicaid reimbursement rates in that 900 million. And we're trying to also save a higher ed system from collapsing as well. So I'm just trying to be really, really proactive with meeting the urgent need now of our most vulnerable citizens, while adhering to guardrails to pay down debt and to create a robust surplus. But it is raining, so that rainy day fund needs to go to those who are getting drenched.
Thank you so much for your testimony. Thank you, Madam Chair.
Thank you very much, Representative Hughes. And again, I would point out that we did increase some Medicaid rates last year. Of course, the governor did revoke some of those increases in his rendition of budget adjustments. And I have not been I don't think either Representative Walker and I have not been that we have been the most stalwart supporters of nonprofit funding. 4 years ago, they were asking for $486 million. Their request this year is $186 million. We have been dealing with this issue for a long time. And we could give you chapter and verse all the problems that we have with the budget, but we know that we can't add 900 million every year to a budget we will shortly run out of cash. So I want to make sure that people, and both Representative Walker and I sat here and sat in rooms while all the rest of the legislators were home, sat in rooms to discuss the 2017 budget for months and months and months on end. Where we were cutting things at $10,000, at $100,000 to bring our budget under where we could get the budget passed. And I don't want to get back to that. So before we add on all these things and make promises to people that we will not keep long term, we are trying to balance the needs with balancing the long-term outlook on our budgets in Connecticut, so that we don't go back to 2017 and put our future colleagues in a place where they have to find $10,000 here to cut, $10,000 there to cut, as they search the couch cushions, and we end up closing things. So I think we have to have a balance.
Yeah.
But I do appreciate.
Yeah, and that's why I want to really, urge the entire legislature to consider some of the revenue raising bills, the equitable tax justice bills, HB 513, SB 35, and SB 36, the child tax credit. Because
I will let you take all of those revenue options right over to the Finance Committee.
Okay.
And I will talk about the spending and the results of us having to cut that spending if we overcommit.
I hear you. I appreciate you and Representative Walker's extreme commitment to a sustainable budget, and I applaud you and support that.
Thank you. Appreciate it. Have a nice day.
Okay.
Up next is Mr. Stever. I believe you are right there. Yeah, he knows. You have 3 minutes, Mr. Stever. You might ask 1 or 2 questions.
Good morning, Madam Co-Chair, Senator Austin, and Co-Chair Representative Walker, and distinguished members of the Appropriation Committee. I'm here to talk about HR 5006. I guess I'm on the wrong side of the equation here today, because I want you to spend some more money. Now, in comparison to what you've been hearing, I have only a small request, it's only $34 million. My name is Zell Stever, and I live in Groton, and I'm a member of the Connecticut Council, Public Council on Transportation Council, and I'm here to support the passage of this bill before you. The actions taken by Connecticut last year to cut passenger rail service has caused significant harm to the citizens of Connecticut and our coastal communities in particular. This decision has made it more difficult than ever for Connecticut to meet its goals to reduce vehicle miles traveled, greenhouse gas emissions, improving our air quality, and support public transportation for all. What is interesting about this conversation you just had with some of the earlier people you've talked with is that if you don't look at this in a broader perspective, you may cut the service on Shoreline East now, but you will pay dearly in transportation costs on the highway in the future. And then you'll pay dearly for air pollution problems that are a result of those extra vehicles on the road. And the argument goes on from there. And it also restricts what is our possibility for economic development, particularly in Eastern Connecticut. Let me say that basically the public needs to travel. And it is been suggested that the COVID has been the reason that we have cut these services. And while that may be true, and that has happened across the state, people still need to get to work. And particularly in Eastern Connecticut, you don't build submarines at home. You don't test drugs at home. You test them in laboratories. And if you work for the United States Navy or you're enlisted in the United States Navy, you must go to work or you must go to your boat. So travel is a required element in what people have to do. Without having a good train system, then this forces people back to the roads. You simply can't walk easily across the Gold Star Bridge from New London to get to Electric Boat in Groton. It just doesn't work. The reduction that has happened last year went from 23 trains to 16 trains along the shoreline, and it has both basically wasted the resources that we've already spent in Connecticut. We recently purchased a whole bunch of new electric cars, the M8s, and they're now sidelined. And so those are already on the books, and we have them sitting here and we're not using them.
So Mr. Stever, if you could wrap up and then we may ask a
I
couple
will
of questions.
wrap up. I provided you all with a statement, and let me simply say that it is well understood that there are three key conditions for successful passenger rail. Has to be frequent service, it has to be reliable, and it has to be operated in a way that gets people to where they want to go. And I'll be happy to answer any questions.
Thank you very much. I really appreciate what you're saying. We know that that $16 million, Representative Walker and I were in the room when this was discussed. We both vehemently disagreed with the cut, and essentially we were overruled. We know how important rail is to Eastern Connecticut and to the rest of the state. And it's particularly sharp to see the cut happen in just one section of the state. And that is really the crux of the problem. My co-chair actually went to an event. Can I tell my story? You can. I won't say any more than that. Yes, I can. But I really think that this is extremely important. And I don't think people understand Eastern Connecticut. They don't seem to understand that we are hiring 5,000 people a year to work at Electric Boat. 5,000 people a year to work at Electric Boat. We have 10,000 people that are working at our two tribal nations in a variety of ways. We have Pfizer, which is working towards, and we're one of the main reasons why we recovered from COVID. To say that this is something that we should not be putting money into is not only unrealistic, it is not a good economic move for a section of the state that needs to move people around on small country roads without any ability to address the issues. So I appreciate you coming. I know that Representative Nolan has a question for you.
Gonna actually, because I'm sitting closer on
You
the
want
side.
Representative Walker
Yes.
first? Okay.
Thank you. Oh, you're gonna get.
Thank
Thank you, sir, and thank you for your testimony. And Senator Austin is accurate on this. We were stymied at the suggestion of the reduction in the train system going along the shoreline because, and everybody says, well, one of our best products is our marketing because in tourism. So we're shutting off the access to Rhode Island and Massachusetts by shutting down the system. If anything, we wanted it to expand and go further into that area so that we have more tourists hitting the shoreline because we have a beautiful shoreline and we want to capitalize on that especially. As my co-chair was going to tell you, I went to an event for someone one day and there were a lot of state troopers and police and somehow, and I do not carry the plates or anything, but they knew I was a state rep. And I got a tongue lashing from all of them because they all live along the shoreline. And they said, you have interfered with our ability to actually get to work every day by having this reduction. So I explained to them that they needed to write to their state reps and their senators and say that this is not one person, it is all of us because our state needs to be represented and exposed to opportunities that happen with trains and buses. So we are going to continue that fight. And we could not understand because they expanded going to Waterbury. They maintained the New Haven a bit. They reduced part of the New Haven, but then they really reduced Shoreline East, which it just, I mean, there was no logic to it. And we were really upset about it. So thank you for your testimony.
Senator Walker, thank you. I think you'll see in the record, there are some 50 people that have taken the time to write to this committee. And I should also tell you that no one has opposed it and as far as I can tell. And then I can also tell you that in the Transportation Committee where this is brought up, there were 175 people who took the time to communicate with them about how important this is.
Thank you. Thank you, sir. Representative Nolan.
Thank you, Madam Chairs. I just want to commend you on coming forward. And as you know, we have been having numerous meetings in the Southeastern Connecticut region in regards to the loss of, the funding that we need in order to continue the traveling and the service that Southeastern Connecticut needs. You touched on some good points in regards to negative effects, limited mobility that reduces the train service, forcing our residents to rely on less efficient and more costly transportation methods. And it increases the traffic congestion, not only in our communities, but throughout the highways. Isolation of communities was a big one because it limits or stops our communities from going back and forth, especially our youth. Our youth that traveled up to New Haven or to Hartford for school or for college, it limits them. It limits our workforce. And we know, and the governor's office knows that having availability of Shoreline East improve improves our commuter options. It enhances the employment and education aspects for our communities, the environmental benefits of it, and especially the tourism and economic development. And I know you touched on those a little bit, but I'm gonna try and give you a little bit more time to just touch on how you believe that it improves the commuting options, the
Well,
availability, given availability to people.
well, there are a couple of, if I understand this correctly, there are a couple of matters that have been raised in the press particularly, and that is that we don't want to fund shoreline east because there is not appropriate dense development around the rail. But let me say that no community is going to rezone or zone an area around a train station unless there is frequent and reliable train service. That's the first thing. I should also note that in New London, as you well know, in Groton and in Stonington and in Westerly, there's huge efforts to actually start to cluster zone around these old center communities, which sets it up for transit-oriented development.
And you touch on something really important there, the building of housing stock on that transportation line, because both New London, Groton, Stonington, I think Stonington, I could say New London and Groton have definitely increased the amount of housing in that area that the governor asked us to build housing in. I know New London probably has over 1,000 new places to live. Groton is about to build and is in the process of creating probably between 300 plus areas to live. So it kind of got disappointing for all those residents that we went out and during our election, during our campaigning, that we said, no, come on in and move into New London and Groton, because we do have the availability of trains, and it grew a great amount, just like the governor asked. So but to remove that now really puts a blemish on it.
Well, I think there's an interesting point you make here, in that you and I are right now talking about extending shoreline east, and that's what the essence of what you just said was. But I'm making the point that in order to extend shoreline east, which I think will be a separate conversation possibly next year, we need to get back to what we had before.
Right.
Because what we've lost before really prevents people, and you see it in the numbers. The numbers have dramatically fallen on shoreline east between New London and New Haven. And that is what the problem is. We have to get that back up and operating so people feel comfortable about stepping out of their car and stepping onto the rail. And that is not something that happens overnight. All you got to do is miss the train twice to New Haven, and your boss says you're late and you get docked, and that's a problem. And it takes time to bring that back. It is not something that should be happening on a yearly cycle. It needs to be a concerted effort to make this work.
Yeah.
And that's what the experience is across the country.
Yeah. Well, I can also say, we can never meet enough about this, because there are a lot of people who are even requesting to get together again and have some of those discussions that we've had. So I look forward to setting up some more time so our community can really come out and speak and be the voices for those that this affects.
Yeah, Representative Nolan, we'll look forward to seeing you next Wednesday in New London, where we'll have one of these meetings.
Thank you, sir. Thank you, Madam Chair.
Thank you very much. Representative McCarty?
Yes, thank you very much, Madam Chair, and welcome, Mr. Stever, to the Appropriations Committee, and thank you for your testimony today. I think my colleagues have expressed it very well. This is very important to our southeastern Connecticut that we do something about the rail system. And I know there was a prior study and that we were looking to expand the rail service, and now it's being cut back. And I think it is not going to help our region. I'm so grateful to our chairwoman, who's been a very strong advocate, as well as a bipartisan Southeastern delegation, to say that we have to do something here to increase the rail service. I just spoke to someone a day or two ago, just what you're saying on workforce development, and because of the cutback, it's difficult to get to the jobs down in New Haven, and it's doing some very harmful impact, I think, to residents that are trying to be self-sufficient. And if you may just want to, you talked about the economic development, the environment, tourism, but could you also comment about, you know, the population in Southeastern Connecticut? Many of these people are don't have the high income that some of the other regions in the state may have, and they depend on the rail for their livelihood. You look at the Alice report that has come out, and I'm fearful that we're going to really be doing some harm to a whole segment of people that absolutely rely on the rail. And if you'd just like to comment a little bit about that part.
Well, I am not a demographer, so you're talking to a person who's not coming from a demographer's point of view, but you're correct. There is a large population that is on the lower end of the spectrum of finances. That having been said, there now is this huge effort to now bring more than 5,000 people to the area for really good jobs at Electric Boat. And what gets unsaid is that for every new submarine we put together, the Navy very quietly brings in 2 new crews to run that submarine. So there's a multiplier effect here that goes on. And as it is right now, people have to drive to get to Electric Boat. Basically 80 some odd % of the people who go to both New London and Groton come in private cars, single occupancy cars. And so that's huge in terms of the number of people I have there. In Groton alone, 27,000 people, and we're a community of 40,000, 27,000 people drive to work from outside of the area every single day. And so that's really important. Now, on the other end of this equation, there are people who are, should we say, my age, who would much prefer to take the train to see our sons and grandchildren in New York City by taking the train, because it's an absolute nightmare getting on I-95 and driving the entire length of I-95 across Connecticut. So it affects not only the lower end, it also affects the middle, but also the upper older end, if you will. So it is across the board that this is important. And then you have, as you point out, and Representative Nolan points out, there's this huge impulse or input of summer tourism basically coming to the Mystic area every year. I mean, it is a huge number that just comes in to see what's there, the aquarium, the seaport, and then downtown.
No, thank you very much, and thank you for emphasizing the true need. And I had forgotten about the aging population, but that's also another concern, that we don't deprive individuals from being able to go into the city or into New Haven. So I don't think there's any argument here with any of us in Southeastern Connecticut that this needs our attention, and that we have to advocate strongly to get this expanded and back to pre-pandemic levels. I think it's
Representative, I would also suggest that the way we're doing this, the way it's being managed is being managed on what's called a fare box system. In other words, if you put the nickel in the box, you run the trains. The train's not full, then the per person subsidy goes way up. And now it's being talked about to get on Shoreline East. It's $130 per ride that we're subsidizing it. And that may be an inappropriate way of doing it. We have to think about, particularly about mass transit, public transportation, as a public good. And so it's not just a simple put the dollar in the coin box or the collection box. It is how does it affect not only the individual, but the entire operation of the economic system that we have. And so I would encourage you to look at sort of the economic value added approach. And that will change, I think, the dynamics that one would then look at how the private sector invests in our community, because that's really what's going to drive it.
Thank you very much.
One more person for comments or questions. Senator Marks online. Senator.
Thank you, Chair. Thank you, sir, for all your advocacy. Just quickly, I'm not sure what the meeting is Wednesday, but I hope all of us get an invite because we're all very interested in saving Shoreline East. I have used Shoreline East often. I have a daughter who had some medical, special medical needs that we would have to go to New York at times once or twice a week. And taking Shoreline East and then Metro North saved us hundreds and hundreds of dollars, which was great because it was costing me hundreds and hundreds of dollars in copays. And it took a lot of the anxiety off from having to drive to New York City. And then my son used Shoreline East all the time when he went to Southern. So we are a family that used it often. And I love going into the city, but now we have to drive to New Haven to get Metro North. And that's just very disappointing that we can't park our car downtown New London and just take the train the entire way. And so my question to you is, and I could look this up, but I keep saying I'm going to. When I met with the people with a higher ranking than the answer to me was just take Amtrak. And I was like, I can't afford Amtrak. I cannot afford Amtrak. So do you happen to know, like off your top of your head, the difference between taking the train to New Haven on Shoreline East than it is taking on Amtrak?
I confess that I can't tell you exactly, although I'm about to find out because I'm about to go to Washington on Amtrak. But there is a huge difference, and you're correct. The Amtrak has got a particularly onerous way of doing it. If you order up the tickets a month in advance, it's a lot cheaper than if you get it the day before. I can tell you that the prices are really very different. I mean, I can go all the way to New York City on my senior fare for, I think it's a little about $20, and there's no way you can get out of the station on Amtrak for that kind of money. And so it's a big difference in terms of what the cost is just to ride the two different systems. But actually more important is that Amtrak does not stop at all the stations. Yeah. Amtrak stops infrequently at I think twice or three times a day in Mystic. It stops more frequently in New London, and then it blows by a whole bunch of stations between
Yellow Leary
and New Haven. So it is a difficult kind of a analysis that you'd have to do because it depends on where you start from.
Well, and also that you have to then pay for parking in New Haven if you're going to go on to New York. And it's just, the train is the best way to travel. And I'm just so disappointed. If you build it, we will send you money. And New London did exactly what we were told to do, 1,000 units in downtown New London. And then they did not keep their promise of funding Shoreline East. So thank you. I know you are just, when I was looking for people to testify, Mayor Passero, your name was the first name out. And thank you for just not giving up on this. And you have the support of all of your legislators.
All set, Senator?
Thank you.
I'm not the mayor, but that's all right.
Yeah, we get it. Close.
No. I said that the mayor told us to call you. That's what I'm saying. The mayor told us to call you.
Thank you.
Thank you.
So, Mr. Stever, thank you very much for your comments. We really appreciate it.
Thank you very much. And I would look for a positive response from the Appropriations Committee. And
We will see what we will do.
We'll work hard. We always do.
Up next is Patricia Jordan, retired educator.
Thank you. And good morning, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Pat Jordan, and I'm a retired educator with 38 and a half years of experience as a mathematics teacher in Waterford. This is my 8th year of retirement, and I am also a proud member of the CEA Retired. I testify today in support of Senate Bill 377, specifically Section 5. This section of the bill will align the date of elections for all the teacher retirement board members, beginning in July of 2027. The highlighted section of the bill is needed following last year's addition of 2 new retired members to the TRB, an increase that both CEAR and CEA supported. Active and retired teachers have the right and responsibility to elect people to the TRB who will best safeguard our pension benefits. We all have a vested interest in the board and their function. Having 2 elections is an inefficient use of valuable resources, not to mention a very costly endeavor when monies could be better used elsewhere. Active teachers and retired must act with one voice at the same time. This fix is a necessary step for our TRB, ensuring that our elections operate as efficiently and cost effectively as possible. I urge you to support Senate Bill 377, and I thank you for your time and your attention.
Thank you very much. Representative McCarty?
Thank you very much, Madam Chair. I really, Pat, just wanted to recognize you and thank you for your testimony and particularly for your 38 and a half years of service teaching math in Waterford schools. We appreciate you, appreciate your testimony. Thank you, Pat.
Thank you, Kathleen.
Thank you. You're all set, ma'am. Up next is John O'Connor, CSU AAUP.
Good morning, Senator Austin, Representative Walker, and all the members of the Appropriations Committee. My name is John O'Connor, and I teach at Central Connecticut State University. I am part of the CSU AAUP leadership, the faculty union that represents 3,000 full and part-time members in New Haven, Willimantic, Danbury, and New Britain. CSU AAUP is a member of the Connecticut for All Coalition, an organization that is working to both reduce income inequality and build equity across our state. I'm speaking before you today in support of SB 50. I understand that this committee must be tired of hearing about fiscal guardrails, ARPA funds, and the many forms of unmet need in our state. But by enacting SB 50, we would create some space under the spending cap that would allow us to spend more in those areas of great need. Everyone who will appear before you today knows how difficult your job is. But we also know it's important that our distressed municipalities receive an increase in supplemental funding that supports our most vulnerable communities. Direct assistance to those communities, whether it's in the form of grants or loans, has been excluded from the spending cap from its inception in 1991 through 2017. With the 2017 budget deals, levels of aid directed toward our struggling communities were limited. Without exempting aid to distressed municipalities from the spending cap, as SB 50 does, will be exacerbating the inequities between our wealthiest and poorest communities. Exempting aid to distressed municipalities will also free up much needed room under the cap to supplement funding in key underfunded public services, public higher education, healthcare and childcare, and public pre-K to 12 education. As you all know on this committee, our public state universities and community colleges are facing a $140 million budget gap that has been addressed through academic program reviews, mitigation plans, and tuition hikes. The CSCU budget deficit has been reduced to $47 million. This is in addition to long-term declines in faculty positions and a drop in class offerings. It is the students who suffer from these budgetary shortfalls. SP 50 would provide some flexibility to address our system's issues and problems. Rigid adherence to the fiscal guardrails will prevent us from changing the nature of our state. By enacting SB 50, we will allow for the flexibility that is needed to take care of our communities, but also to ensure that the educational experiences of students in K through 12 schools, but also in the community colleges and state universities, will have an experience for the better. We should never allow any of our students to fall through the cracks due to budgetary constraints. CSU AUP urges this committee to support SB 50. Thank you for allowing me to appear before you this morning.
Thank you very much, sir. Are there any comments or questions? Representative Johnson, are you going to tell him that we have to rebase if we take it out and there's not going to be room under the cap?
I think you already did that.
Okay,
Jennifer. Thank you so much for
Appreciate it.
having the
Just wanted to
conversation.
say it.
I
Thank you.
do appreciate the fact that we have a chance to have a discussion about where we are, and the fact that our students are having to suffer with an increase in tuition. And I represent the district that has Eastern Connecticut State University in it. And I've met with the students and with people at Eastern and at UConn. And the cost is going up while the access to our school curriculums has been limited and created more cost for the students, especially students that have to take out loans and pay them back over the years. So I just wanted to know if that is the experience that you have had, if you wanted to just tell us a little bit about how students that have limited resources are affected by these cutbacks in the university system.
Yes, Representative Johnson, certainly that is the case at Central, in which class offerings have declined. My department, the sociology department at Central, I think we're down 3 full-time faculty members. We have important offices across our campus in which we're struggling to fill positions. So yeah, when we think a little bit about this sort of budget, the budget gaps that our system has, it's absolutely the case, as you pointed out, that it's going to be the students who are going to really pay the costs of that. And that should never be the case. They are really the innocent folks in all of this, and yet they're the ones that in many ways pay the bill. So you're absolutely correct, Representative Johnson. What's happening at Central is the same that's what's happening at Southern, and Western, what you see at Eastern.
Thank you for taking the time, and thank you for your testimony. Thank you so much, Madam Chair. Much appreciated.
Thank you. Anybody else? You're all set, sir. Up next is Kate Mazzata. Kate?
Before
Now we get to grill her.
Good morning, Representative Walker, Senator Austin, and esteemed members of the Appropriations Committee. My name is Kate Mazzata, a resident of East Hartford, and I am here to testify in favor of House Bill 5430, an act concerning a study of migraine treatment for women and veterans. I am here to speak to you about my journey with migraines. Data shows that 17.5% of migraine sufferers are women, and I am one of them. I have suffered from chronic migraines since I was 17, and over the years, I have had multiple people dismiss my pain repeatedly. In high school, teachers and school administrators said directly to my parents that I was lying. As I was suffering, I couldn't fathom why I was being accused of lying when I could barely climb the stairs in my own home without feeling like my head was going to explode. Over the last decade, I have lost track of the number of medications I have been prescribed in attempting to ease my pain. Currently, I am on 5 oral medications. I get hooked up to an IV every month, and I get Botox injections every 3 months. I still have daily headaches without any answers. I have seen countless doctors and experts who have chased down theory after theory as to why migraines devastated the life of a healthy 27-year-old over the past 10 years. There is a lack of migraine and chronic migraine research, which has prevented me and others like me from getting answers. Why? Migraine is classified as an invisible illness and disability. It is often overlooked, not taken seriously, and highly stigmatized because they predominantly affect women. However, current research also shows veterans who experience head trauma are also more likely to suffer from migraines. The lack of education and information can often lead to a misdiagnosis or outright dismissal of someone's pain. The passage of House Bill 5430 would establish a study at the Yukon Health Center to evaluate migraine treatment specifically for women and veterans. This is important because 3 out of 4 people who suffer from migraines are women, and post-traumatic headaches occur in up to 92% of military personnel who have sustained a mild TBI. Women tend to report more painful, longer-lasting headaches and more symptoms such as nausea and vomiting, while the frequency of chronic daily headaches in soldiers after a deployment-related concussion is 20% higher than the general U.S. population. The debilitating disability that is migraine affects 1 in 4 households in the U.S. and over 1 billion people worldwide. Migraines do not discriminate. Anyone can suffer from migraines, and we all deserve to have some form of control over our pain and bodies. Thank you for the opportunity to testify today, and I would be happy to answer any questions that you have.
Thank you very much, Kate. And I think that you've done a well-researched project here to bring us this information. I appreciate all the hard work that you have taken, and the fact that you have been able to speak in public and come out is really important for public policy. So appreciate your work. Representative Walker.
Thank you, Madam Chair, and thank you, Kate, for talking to us about this. I know everybody is not that aware, but yet when you talked about it, I remember now seeing Serena Williams, Lady Gaga. They're all, I mean, people are coming out of the woodwork and talking about the impacts of having migraines, and it is women. So can you tell me what is the journey? I mean, you listed a lot of medications that you're taking. How difficult is this to manage and also have a job, go to school?
It's very difficult. Like I said, I've been dealing with this for, it'll be 10 years this year. I have been on, like I said, I've lost count of the medications that I've been prescribed over the past 10 years. I still get daily headaches, but the regimen that I am on right now is allowing me to go to school, have an internship, live a normal life, but it is a daily battle. And unfortunately, even though I am on a regimen that works for me, no one has been able to provide me an answer as to why I have migraines. And so it has been very hard for people to say, well, this medication stopped working because, so here's a new one. It's just this medication stopped. And so that has been really hard. And I'm very fortunate that it took a long time to find something that works, but something works now for me. It's just unfortunate that it's a long, long journey for me and people like me to get to this point.
I think the thing that bothers me the most is the fact that mostly women are affected by it. So that people tend to put it to the side. Oh, they're having their menopause, they're this, that they come up with other excuses why you have these migraines, except for the fact that they cannot come up with a cure. So I thank you for bringing, because I just started learning about this, and I'm very sorry that we don't have enough information to actually get a pinpointed diagnosis for this. So I think with your advocacy and hopefully with UConn, maybe we can come back next year with some real answers and real research. So thank you so much for your advocacy.
Thank you, Representative.
Any other questions or comments, Representative Nolan?
Hello today. Good to see you. And I just want to thank you for being a staunch supporter of something as such that you're coming before us today, especially for veterans. We already know a great deal about women getting migraines. My wife tells me I give them to her all the time. But I really, truly appreciate your advocacy for this, especially around improved healthcare for women and veterans, because I think by identifying the treatment and management, this could help us as legislators go to the next step in regards to the action that's going to be needed after the study. So I really thank you for that, because I know that it is going to enhance the quality of life for those, and also reduce healthcare costs, because migraines are so bad for, I know a lot of people that they go right to the emergency room. And it's not just one or two people. There's hundreds of people that are going to the emergency room or to the VA in regards to trying to deal with that issue. So I thank you for coming before us, and I look forward to having further conversation with you about things, especially for veterans.
Thank you.
Representative McCarty.
I'll go very fast, but I too wanted to add my voice and thank you for coming out and bringing this very important issue. And I think you could look at it also as a workforce issue almost, because my understanding that some individuals, these are absolutely excruciating, debilitating episodes that people have with migraines, and sometimes they're as frequent as 14 days a month. So I'm pleased to see the advancements in neurology and looking at what are the actual causes. So I appreciate your advocacy and looking forward to this study. Thank you for being here today.
Thank you.
Any other comments or questions? Representative Johnson.
I just want to thank you as well for bringing this to our attention, and also the fact that when we talk about these things, we create group knowledge. And by being here today, you're doing just that. You're creating knowledge for the group and for people who are in a similar situation to yours. So just wanted to thank you for being here and your remarks and sharing your story.
Thank you, Representative.
Anybody else? You're all set. Up next is Mr. Myers. And after Mr. Myers, we're going to have a panel of young people who are here on Hearing Youth Voices. And they will, I think they're from New London, and they will all come up and sit in the seats behind where Mr. Myers is now. Rihanna Pierre, Jadalise Garrett, Amaya Outler, CJ Parker, Serenity Lancaster, Amaya Willis, Deshaun Phillips, Francesca Bazell, and Raylan Lopez. So you all sit right behind Mr. Myers, and he is going to go before you, but you can all get prepared. And all of the young men who said they didn't want to testify can sit in the seats right behind them so that we also get to call you out too. Mr. Myers, the floor is yours.
Thank you. And good morning, Senator Austin, Representative Walker, and the distinguished members of the Appropriations Committee. My name is William Myers, and I'm a retired teacher. I taught for 35 years, the last 25 in my hometown of South Windsor. I'm pointing at Representative Delnicki. I'm the vice chair of the Teachers Retirement Board. I was twice selected or elected to the board as an active teacher, and then once again as a retired teacher. I'm also a proud member of CEA Retired and a member of ARTC. So today I testify in support of Senate Bill 377. I've worked closely with Helen Quinn Sullivan and her agency the entire time she's been here. She's done a wonderful job cleaning up old statutes or old language and clearly defining the specifics of a very complex set of statutes. SB 377 continues that good work, and Section 5 is a great example of it. Section 5 of the bill would align the date of elections for the Teachers Retirement Board's members. The next scheduled election takes place in 2027. This section of the bill is needed following last year's additional 2 retired teacher election. The increase to both the increase of these 2 sorry. The increase of these 2 additional seats was supported by CEAR, ARTC, and CEA. Everyone was in favor of adding more teachers. The timing of those additional seats created the need for 2 elections in 1 year, and that was a huge and unnecessary burden on the TRB. It also created an additional expense of around $50,000, small compared to some of the requests and needs that have been presented so far, but $50,000 nonetheless. This fix is a necessary step for TRB. It would ensure that our elections operate as efficiently and cost effectively as possible. Thank you for your time and consideration. I'll
Thank you.
entertain any questions.
Are there any comments or questions? Yes, sir. Floor is yours.
Thank you, Madam Chair. And Bill, good to see you there.
Thank you. You too.
And I appreciate your comments. And rather than tie up a lot of time here and now, I'd like to sit down with you and we can have a good discussion.
That'd be great. Thank you.
And I'd appreciate that. Thank you. Thank you, Madam Chair.
Thank
And-
you very-
And again, thank you, Bill.
Thanks.
Thank you.
Are there any other comments or questions? Seeing none, you're all set.
Thank you. Have a
Might
wonderful
want to
day.
stay for the next one because
This is-
teaching is what it's all about.
Yeah, I'm going to stay too.
Okay,
Thank you.
very good. Okay, all of you that are out there, is Rihanna Pierre there?
Who's going to start?
Who's going to start speaking? You guys, just come on up. There's 2 seats there, so
Somebody else can sit next.
somebody else sit there. And when you're done, you get up, someone takes your seat. When you're done, you get up and somebody takes your seat. So we're going to do it like that, okay? Go ahead.
Hello, my name is Jada Leese. I'm a junior in high school, and I have attended New London High School since my freshman year, starting in 2021. I am in support of passing SB 50 because it will help close the gap our school district needs to fund all the supports that have existed with ARPA funds. An example of this would be the wellness interventionist. My experience with the wellness interventionist has been nothing but helpful to me and my mindset while going into school. My freshman year, there would be fights all the time, mostly between the same people, because they would receive suspensions and it would just continue when everyone returned. The wellness interventionist influenced students with a more leveled way to avoid or deal with altercations. Restorative circles are commonly used to dispute issues between 2 parties, allowing both sides to feel heard and have an opportunity for an agreement to be made, good terms or no contact, allowing students to go back to class in a better headspace, ready to succeed. If you look at the data from 2022 to 2023 compared to 2023 to 2024, the suspension rate and the number of referrals has gone down and attendance has improved. The wellness interventionists have come to make a better school climate for students and staff. Having them allow students to be able to have a safe space and somewhere for them to go, reset, and in some cases remind them of their end goals so they can go back to class and be able to function better with their teachers, peers, and within themselves. Personally, the advice given to me by Mr. Richardson, Mr. Parker, and Ms. Charity has had a positive impact on the mindset I have while in school, helping me excel socially and academically. The wellness interventionist positions are a good example of what SB 50 can save in support of our students. Thank you for listening.
Thank you. You're next.
Press the button so your microphone comes on. Yep.
Hello, my name is Amaya. I am a junior at New London High School, which I have attended since my freshman year. As a passionate advocate for education reform and student well-being, I support the passing of Senate Bill 50. One of the critical components of SB 50 is the possibility for our schools to retain the integration of wellness interventionists into school systems. These professionals play a pivotal role in fostering a positive and supportive environment for students. Having experienced the support of individuals like Ms. Charity, a wellness interventionist at our school, I can attest to the transformative impact they have on resolving conflicts and promoting emotional well-being. Ms. Charity has been a guiding light for me during challenging times, providing a safe space to confide in and offering thoughtful resolutions to conflicts with fellow students. Her approach goes beyond mere mediation. She empowers students to develop essential conflict resolution skills, fostering a culture of empathy and understanding. Through her guidance, I've learned the importance of effective communication and empathy in resolving conflicts, skills that are invaluable both inside and outside the classroom. I urge lawmakers to pass SB 50 so that New London Public Schools has a chance to prioritize the implementation of wellness interventionists in schools, as their impact is undeniable and invaluable. Thank you.
Thank you. Next.
Hello. Hello, my name is Destiny. I'm a junior attending New London High School. I am speaking in support of SB 50 because this bill is what's keeping the wellness suite alive in our high school. I know that without them, me and along with many of my peers would be affected. The wellness suite and staff have helped me so many ways personally, the list can go on. Not only have they gave me new ways of thinking, I've also developed new ways to navigate my feelings when I'm going through them. A personal experience that I can talk about was coming into high school after being a full distance learner during quarantine and being isolated from everyone and everything. High school definitely took a toll on me mentally, so walking into high school, I really didn't know what to expect or how to feel. High school comes with challenges, friendships, and people are starting to find themselves. With that comes with a lot of emotions. I know for me it did. Ninth grade year was rough. You can ask any staff in the building. At the time, I was really a person. I apologize. At the time,
Okay, take your time, babe.
ninth grade year was rough. You can ask any staff in the building. At the time, I was really a person that didn't think and just reacted off my emotions. Times like that, I go to the wellness suite and regroup. Staff such as Miss Charity and Mr. Richardson would sit me down and talk to me and not at me. That played a main part in why I think and operate my feelings the way I do now. I definitely can say I have more control over them. Without the suite, along with other staff, I would not have the more mature mindset I do now. This is why funding SB 50 is important to me. Thank you for your time.
Can you say your name again too, please?
Destiny. Destiny.
Destiny. Okay, thanks. You're up now.
Hello, my name is Serenity Lancaster. I am a 16-year-old student athlete at New London High School. I am here today to testify in support of SB 50, which can help positions like the wellness interventionist in our school. Our district needs more money in order to save some key people in New London public schools because they seem to be the only people that can help us in situations that we struggle to get out of. There are multiple incidents in our schools, as in fights and arguments that quickly escalate, and some teachers don't have control over the students whatsoever. With our wellness interventionists, there's a lot of respect that occurs between the two. Students have so much more respect for the interventionists than the teachers. Also, the students have a lot more trust. It takes these individuals a lot of time to try to at least get the kids to trust them, so it can be easier to explain or express things to them their way. If the wellness interventionists were not there when we needed them to be, and at a lot of points, so many things might have gone wrong. Students may have been suspended, expelled, or even worse. They have done so much for New London public school system. Me personally, I can't imagine the high school without these caring individuals. I have had them since high school started for me. They give me and other students a healthier learning environment and better ways to handle things in school and in future life out of high school. Even though our schools are losing the COVID relief money, the need for the supports created with this money still exists. The wellness interventions are just one key example. Thank you.
Thank you. Is there anybody else that's going to speak?
Come on, one brother.
No?
Yeah, come on.
Come on.
Show your voice. Come on.
Can't let the girls show you up. No.
Okay. Good morning. My name is Deshaun Phillips, and I am a student athlete at New London High School. I am here in support of SB 50. SB 50 is a bill that would really help my school because it would give funding to keep very important positions such as our wellness interventionist. I believe that the wellness interventionist job at my school is very important and has a big impact on the kids. My reasoning on why I think this job is so important and impactful is because during my time in New London High School, I've seen the great things wellness interventionists have done for kids in my school. For example, keeping some of the kids that wouldn't be in school or do good in class stay focused and stay on top of their grades and work in school. Also, the wellness interventionist job has helped me in the past, like my freshman year. The wellness interventionist was a great help in my life because it was someone I felt comfortable talking to and someone I could just let all my emotions out to. There were certain days that year that if we didn't have the wellness interventionist job there to help me, I don't think I would have made it through those days with a clear headspace. That's just my story, but I know that this bill would be a big help in keeping the wellness interventionist job at my school. Also, wellness interventionists in the school play a big role in most of these kids' lives. Just because ARPA grants are expiring doesn't mean the need for these resources provided by these grants have expired, which is why SB 50 is so important for me and my school community. Thank you for your time.
Thank you. Is Rihanna here? Is Rihanna here? Come on up, Rihanna.
Come on, Rihanna.
Oh, Lord.
Go.
Hold on, I gotta get it out.
Hello, my name is Rihanna Pierre. I attend New London High School and I will be talking in support of the SB 50 bill. The Wellness Department gives us a feeling of safeness and being understood. I've seen personally how much of a change the Wellness Department has given my school the 3 years I've been there, from de-escalating situations, making people feel like they have someone to talk to, and especially a feeling of not being judged. My personal experience was my sophomore year, just dealing with insecurities and feeling like I had no one to talk to, and I just felt like my high school experience was a good one. And around that time is when I met Miss Charity, one of the staff in the wellness department, who just gave me reassurance and just made me feel like I had someone to talk to because I just kept everything to myself, and also gave me encouragement with school because during that time, my mental health was taking a toll on me. What I am trying to get at is how important the wellness department is and how much of an impact it has in our school. It's not like it's not in use. People in that department give so many people so much encouragement and help, and we need that in our school every day. Without it, I don't think our school would be able to function. This is why the SB 50 has meaning to me. Thank you.
Thank you. So you're all set? Is CJ Parker here? Come on up.
All right. All right, good morning.
Microphone.
Y'all can hear it?
Yeah.
All right. So my name is CJ Parker. I'm the Education Justice Youth Organizer at Hearing Youth Voices in New London. And I'm here to advocate on behalf of SB 50 because of the budget cliff that we're experiencing in our city. So according to one of our city councilors who we met with recently, he said that this bill could cut the gap in half between what our school system needs to maintain the supports that already exist. And so with that, I just want to share some stories from when I worked in the schools. So on the first day of school in the 2021-2022 school year, I entered the energetic cafeteria of Benny Dover Jackson Middle School, which was lined up with desks rather than tables because of COVID regulations. And as I walked in, I watched a dispute over a chair where somebody else wanted to sit. And I watched a student walk up to a desk that already had a student in it, pick it up and dump them out onto the floor. And when the student who got dumped out the chair got up, they started yelling at them, swearing at them, insulting them. And what surprised me was the students around said to the person who dumped this kid out the chair, I would never let someone talk to them like that. And then I fast forward later on, a student dumped a water bottle, an entire water bottle into a backpack. So the other student whose this backpack was fuming. And so when I talked to the student who had dumped the water bottle, trying to see if like at least we could get an apology over the harm done, he said, you can't apologize here at Benny Dover Jackson Middle School because people will look at you as if you're soft. And to further emphasize these points, we had about 7 fights in the first 7 days of school. And that trend continued. In the first 30 days of school, we had 30 fights in the building. So it was obviously an unsafe learning environment and a prison-like culture. And I only share these stories because they're a microcosm of what we have been trying to go up against. And with the COVID money that has created positions and supports and resources in the schools, the students, staff, Board of Ed, everyone is proud of the strides that we have made. As you've heard, school has changed, mindsets have changed. Some of these very young people here are young people I worked with as a wellness interventionist at the school. And I'm fortunate to have this full circle moment where I'm working with them again at Hearing New Voices, seeing the impact that the conversations we had has made on their lives. I'm watching them live the lessons that they learned as 9th graders, as 8th graders, as 10th graders. I'm watching them become clearly valuable members to our community. And if we were to have this conversation 3 years ago, it would have been different. Thank you.
Thank you very much. And I just want the following people to stand up just to say that you made it here. If you are here, Kamaya Willis, is Kamaya Willis here?
Stand up.
Okay,
Stand
stand up. And I have Francesca Bazil. She didn't get and come, okay. Raylan Lopez? Is there anybody else that signed up to speak that I did not see, or you, come on, stand up and say your name, please.
Say that again? Savon Warren.
Yep, I see you right here, yep. Thank you. Is there anybody else that would like to stand up and give their name now? Okay, come on. Say loud. I'm old. But nice to see you.
Huh?
And
One more.
anybody else?
Devin Williams. Denasia what?
Thank you very much. And you guys did a really nice job, all from New London. I think that Representative Nolan wants to say a few words.
Definitely. I want to thank you all for coming and speaking and being advocates for your peers and for what you believe is necessary in our public school system. For CJ Parker and Nicole Brodus, I want to thank you too. You guys do amazing work working with our youth. They are from Hearing Youth Voices, and Hearing Youth Voices helps develop our brown and Black students in New London when it comes to whether it's campaigning or whether it's social justice, whether it's just trying to help with family issues, community issues. You all are there and you all stand up and you make me proud. And I just have to ask Ms. Lancaster to stand, please. Thank you. Ms. Lancaster scored 1,000 points in the past few months in the basketball season that she had. So I just want to thank you so much for all you do for our athletics team. And Devon, right?
Get up there.
Please stand. 1,000 points score for basketball. Thank you so much also. And I just want to wish you guys continued success. I see you back in New London, and thanks again for all of you coming out.
Thanks, guys.
All right.
Wait, we have,
Did you want to say something? Representative McCarty.
1 second.
Thank you very much, Madam Chair. And I just wanted to say hello to all of my neighboring students in New London. Thank you. I thought I was in the Education Committee for a moment. I just want to really recognize you and let you know that we're hearing your voices and that I think the students are some of our very best advocates. You're here today talking to us about SB 50, but I want to assure you that in the Education Committee, we're also looking at bills because what you're saying about maintaining the services, the behavioral interventionists and wellness, those are so important, and we don't want the fiscal cliff to interfere with losing those positions. So you can look at House Bill 5212, I believe it is, in education, which looks at student-centered funding. That's one area. If this SB 50, for whatever reasons, we are in appropriations, but there are other avenues where some of the issues that you bring to our attention are being addressed, also in the safe school nurturing climate. And we do listen to students and are trying to put you on more boards. So thank you very much for being here today. You all did a fabulous job. Thank you.
We have 3 more comments. So Senator Marks.
Thank you, Madam Chair. Thank you, New London. You make all of us so proud. I'm going to make sure that the Board of Ed members also see this testimony. You're making a difference. Hearing youth voices makes a huge difference in our community. I know many of you and your families, and it takes a village, and you are our village, and just bravo to all of you. Thank you so much.
Thank you. Representative Curry.
Good morning. I think we have 1 more minute. So I just want to thank the students for coming out and echo the comments of our good ranking member from the Education Committee. I think what you have done today is really highlighted a lot of the concerns that we as legislators share with respect to a lot of the support services that always should have been included within your schools, but that you were not able to have until this additional COVID money came in. And so we take our responsibilities very seriously when it comes to seeing how we may best be able to provide the funding to allow those things to continue. I know in East Hartford, our accelerators at our elementary schools were able to make great strides in literacy at our youngest ages. And those were the first folks on the chopping block during budget season this year. So when you're making decisions like that, which are in direct conflict with some of the things that we want to see on a statewide basis, it really makes us question the motives of some of the folks who are making some of these decisions. So again, thank you for coming out today, and we appreciate your voices.
You, Representative Osborne.
Thank you, Madam Chair. And I just wanted to say thank you to each and every one of you students who came here today. It is so gratifying to hear about a program that has been so impactful on each one of you, that has been so effective, and that has helped you so much. I would not have understood if I had not heard from you personally how important the money is and what effect it has had on each one of your lives. I am just so impressed to hear from each of you, and I want you to know how important it was for you to come here today. I don't live anywhere near New London. I would never have heard from you or understood the impact that this truly has had on your lives if you weren't here today. So I want you to know that the time you took to come here today, it was important. It meant something. It's going to have an effect. So thank you so much for it's scary to come up here and testify at the legislature. Thank you for your courage. Thank you for your bravery. Thank you for coming and educating me so I can make good decisions on your behalf. Thank you again. And I'm so proud of you. You should be so proud of yourselves. Thank you. Thank you, Madam Chair.
Yeah, one more, Representative Johnson.
I just want to thank you for doing an excellent job here today and being here today to tell us the stories of what have been going on since you've gotten the new money, the new funding, and how it's made a great impact on your lives and your school. And I just can't thank you enough. And I'm in Eastern Connecticut, so I know about New London. I'm glad to hear people from Eastern Connecticut come and testify about what's going on and the improvements that we make when we add funding to the school system. So thank you one and all for being here. Much appreciated. Thank you, Madam Chair.
Any other comments or questions? Seeing none, you are now free to go. Thank you. Up next is Kate Diaz. Kate, are you here? Kate Diaz. And then up next is Susan Halpin. I know, it's Irish. St. Patrick's Day is coming up. Woohoo! The floor is yours.
Good afternoon, Representative Walker, Senator Austin, members of the esteemed Appropriations Committee. It's a pleasure to be before you today, although I will say it's going to be very hard to follow that really eloquent and moving testimony. So I will do my best. I'm here today on behalf of the Connecticut Association of Health Insurers to talk about Senate Bill 372, an act concerning payments by the insurance companies for deposit into the insurance fund. The insurance fund doesn't often get talked about a lot, but it is about $122 million line item in the budget. And it is funded by a series of 3 different formulas or assessments into the fund. And the proposal before you today seeks to take out one segment of the insurance industry from paying for 2 parts of the insurance fund. And that is to take out non-health insurers from funding the Office of Health Strategy for about $12 million and the Office of Healthcare Advocate for about $4.2 million. The result of that, unfortunately, while I can understand where the proponents are coming from, the result of that is that the cost is going to be borne by health insurance policyholders. And those are the least able to afford it in the fully insured market. They're your folks purchasing on the exchange. They're your folks on Covered Connecticut. They're your people, your small businesses that are purchasing in the small group market. And that associated cost would be passed down to all of those policyholders. If we could, we'd like to suggest 2 different ways that you could go about this alternatively. One would be to do a general fund appropriation, and I've sat through enough hearings to know how challenging that is. But the second would be to convene a working group, and this would be a working group that I think whose time has really come, because there's been a lot of challenges with this fund. It's very complicated. It is
like I said, funded by three different assessments on three different groups. There's another portion of the budget under there that goes to fund DPH programs that used to be funded by the general fund, but during the deficit years, they were shifted over into the insurance fund. And only the health carriers and their associated TPAs pay for that. Within that is the vaccine fund, which we do not quibble with. And that is probably the largest part of the insurance fund, or close to it, at around $50 million. That purchases goods and services. So that's not something that the health insurers are opposed to or seeking to change. There are other states that do that privately as opposed to through the insurance or, the insurance fund. So this was an opportunity to highlight that too. So I'll close and I just hope we can work with you going forward to look at alternative solutions and ways we might be able to streamline the process. So I thank you for your consideration.
Thank you very much, because this is something that I started working on last year. And I think that we really have to get people together on it. One, I know that the CIFSIC fund has a section that is borne by the property insurances that is not borne by the healthcare insurance. This is my understanding. And I do think that that's the right way for that to go, because they are directly related to that. I'm increasingly concerned, as my co-chair is too, on the buildup of the healthcare strategies and some of the expenses that we have included for insurances to pay for that don't seem to have any end in sight or any real results. For example, the healthcare strategies is supposed to do a certificate of need. We have 3 hospitals that are significantly at issue right now, trying to get that purchase completed. And it has been close to 2 years that we have been waiting for that certificate of need to end. So I personally think we need to reassess what we're doing with this fund and not continue to put more expenses on the insurance funds broadly without any understanding of what that cost is going to be, because it's not like insurance companies pay for this fund without passing the costs on to those that are purchasing insurance, or whether it's healthcare or it's property and liability or any other form of insurance. The fact is, anything that we require them to pay, that money has to come from where they get their money from, and they get their money from the people that buy their insurance product. So I do think that we have to look at this, and I appreciate your comments. I just wonder if anybody else has any comments. Representative Walker.
Thank you. Thank you for your testimony. Can you sort of let us inform us on just some of the things that domestic life insurance companies pay for through this fund and what's being used for right now? Just a few things.
Domestic insurance companies, so that would be all inclusive of health insurers, property casualty, auto, life, title insurers. It really runs the gamut. So when you go through the budget and what's paid for, there are positions at the Office of Policy and Management. There are positions at the Department of Administrative Services. There is, of course, the insurance department itself, which I don't think any of us challenge at all. There was the new Office of Behavioral Health Advocate that was created last year. There's the Office of the Health Advocate. There's in the Department of Housing, the Crumbling Foundations. There's programs at the Department of Health, the Needle Exchange Program, Children's Health Initiatives, AIDS Services, Breast and Cervical Detection and Treatment, Immunization. I'm sorry, that's not domestic. That's just on the health insurers. Sorry. And then there's the Office of Health Strategies, which is, as I mentioned, budgeted for 12.6 million for 2025. There's the Managed Service System under the Department of Mental Health and Addiction Services, Fall Prevention under the Department of Aging and Disability. And that's it. That was the last one.
Oh, that was the last one. I think the thing that really scared me or shocked me was the amount of things that are paid for in this fund. And as my co-chair said, last year, we were extremely upset about the expansion for the Office of Healthcare Strategy. I'm not saying that it's not needed, but it shouldn't be coming out of the insurance company. We have quite a few things that the insurance fund is paying for that are very valuable for us, but we shouldn't just continually compile more. So thank you. Thank you, Madam Chair.
Thank you.
Thank you, Representative Johnson.
Thank you, Madam Chair, and thank you for your testimony today. I just wondered, when you talk about the increase in the cost to the person who's purchasing the insurance policy through this, in terms of the medical loss ratios or just the loss ratios, would there be a change in those sorts of things? And the last I looked for the private health insurance folks, it was about an 80-20 split. I'm just wondering if that would change that, or do you have any information about that?
These costs would fall, as I am thinking about your question, in that administrative component. So certainly eating up additional administrative dollars that are built into the premium. But yes, the carriers have to spend 80% for the large group market. And if they go below that, they have to refund those dollars to their employer customers. Similarly, on the small group and individual side, they have to spend 85% of the premium dollar on medical and would have to refund the difference if they went below that. So you're correct. It kind of gets thrown into the mix master and all comes out in that manner. Thank you for the question.
Thanks for your answer. Thank you, Madam Chair.
Thank you. Representative Harrison.
Thank you, Madam Chair. You did very well rattling off that very long list.
Thank you.
And sometimes visual is a great thing. Is it possible for you to send that to us so we can take a look at it, and any other additional information, whether it's ratios, percentages, dollars, that you have stacked up with that?
Sure, I'd be glad to.
Thank you very much. Thank you, Madam Chair.
Thank you. Representative McCarty.
I wasn't going to speak, but thank you.
Always
Thanks,
nice to see
Susan,
you.
for your testimony today. And I appreciate your suggestion that we form a working group to take a look, because I think some of these were pushed over to the insurance fund during a time that was different in the state of Connecticut. And it may be time for us to really take a good look to see what should be there and what possibly should go in a different fund. So thank you for coming in today.
Thank you for having me.
Thank you. Are there any other comments or questions? Seeing none, thank you.
Thank
See, we
you as
weren't mean
always.
to you at all.
You weren't at all. It's a pleasure to come before the appropriate. Now I'm going to keep coming. Thank you.
Up next is Christina Barman. Christina.
Hi. Good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee. I'm Christina Barman. I'm a professor at Central Connecticut State University. I'm a member of CSU AAUP and the Connecticut for All Coalition. And I am here today in support of SB 50 to adjust the spending cap and allow more aid to distressed municipalities. It's really, I've been here a number of times, over the past few years. It's really surreal to see this budget crisis and proposed austerity budget being manufactured by a Democratic governor. The austerity we're seeing is a flashback to the early 80s when funding was cut and the basic functions of our government, like education and public health, were sabotaged. The result was that the money did not trickle down. Poverty and inequality has only grown since. And currently they're at their highest level since before the Great Depression. Connecticut's budget is similarly unequal. It hurts the most vulnerable in our state. But, being here and asking for money over and over and over again, I want to be clear, we're not asking for handouts or sympathy. We're asking to fund the basic functions of our state, right? I have a background in public health and sociology and gerontology. So I just, I want to tell you that there's an overwhelming amount of research that shows how bad inequality is for our quality of life, health, and longevity for all of us. And this is especially ironic coming from a Democratic governor who espouses the ideals of equality. And it's undemocratic. The budget crisis he has created has shifted control of the budget to him, and that's your job. That should bother our representatives on both sides of the aisle. So I'm asking you to do whatever you can to remedy this. Before 2017, spending for distressed municipalities was outside of the spending cap, and this allowed for more flexibility under the spending cap. Distressed municipalities are areas that were formerly redlined. This means that they were created and the inequality was created by policy decisions, right? And because of this, they have a tax base problem and don't always have the ability to make the investments in needed services. So remedying this inequality is also an important policy decision that is up to you. Investing in these communities invests in all of us, and this will create jobs and be good for the economy, both in rural and urban areas. So we all need transformative investments into our public services and institutions in order to thrive. I'm asking you to do whatever you can to modify the fiscal guardrails that are hindering your ability to do your job. Thank you for your time.
Thank you. Are there any other comments or questions? Representative Johnson?
Thank you so much for your testimony. And just quickly, I am hoping that maybe you can just expand a little bit on the fact that the municipalities that are distressed, that I call serving towns, because they serve the regions with nonprofit organizations and they have a diminished tax base. Could you just tell us a little bit about how that impacts the students in the universities and also in the local school systems?
Yeah, I mean, because they've had an inadequate tax base, we have, it's one of the causes of the unequal funding for K through 12, right? Because a lot of this comes from property taxes. And because the redlining created a rental market instead of home buying, the property taxes have remained low, and they're the areas that have the public buildings that don't have the property taxes. So they have less money for property taxes, which creates less money for K through 12, which creates a lot of our disparities in education. And then this, these are the students we see in our classrooms. And so we have just a huge variation in the students that are prepared for college. We have students that are amazing and can compete with any of the students from private schools anywhere in New England. And we have students that are incredibly capable and have been shortchanged for a really long time.
Thank you so much for that. Thank you, Madam Chair.
All set. Anybody else? Seeing none? You're all set. Thank you.
Thank you.
Victoria Staub. Victoria? Eric George?
Good afternoon, Senator Austin, Representative Walker, members of the Appropriations Committee. My name is Eric George. I'm president of the Insurance Association of Connecticut. I really did want to be with you today. If you hear background noise, that's the reason I'm not with you today. I thought Susan Halpin did a nice job of explaining how the insurance assessment and the insurance fund works. I don't find myself in the position of disagreeing with Susan that often. This is one of those instances where I'm not sure if it's a disagreement, but perhaps just a different priority. I fully support this committee looking at the overall insurance fund and where monies are going. But I don't think that needs to be done at the expense of Senate Bill 372. Senate Bill 372 would realign the insurance company assessments so that there is at least some connection or nexus between those insurance carriers and the two organizations, the two offices that we are focusing on, the Office of Health Strategies and the Health Advocate. Auto, home, and life insurances have no connections to those offices. And I want also everybody to know that Senate Bill 372 is revenue neutral. This will not impact the offices, either of theirs revenues. We do believe that there needs to be this realignment. I understand the point that folks are making that certain insurance costs may have to bear a new proportion. But I want to point out also that auto, home, and life insurance costs, since this practice has been in place, have had to go up because this has been put into their bill. I thought Senator Austin, you and Representative Walker brought up very good points that, you know, we have obligations as insurance carriers to make sure that the premiums we take in are sufficient to pay the claims that are going to come due. And when hidden let's just call it what it is. When hidden taxes are included, we need to account for that. Insurance carriers have to have their rates approved by the insurance department so that we are actuarially sound. And that is why when something is placed upon this that is not part of the typical calculation of premium, it does impact the cost to the consumer. So you have my written testimony. Again, I really think that all of these offices should be borne through the general fund, not necessarily hidden in the insurance fund. And I fully support you in and I'd like to be involved in taking a look at how the insurance fund is currently divvied up. But I don't think that needs to be done at the expense of Senate Bill 372. I'm happy to answer any questions.
Yep, I have one. Representative Walker?
Thank you. And thank you, Eric, for your testimony. First of all, my husband and I just got our insurance bill, our car insurance, and he called the insurance company because it went up. And he was irate because we have not had an accident or any claims in over 35 years. But yet, because of the other costs that are hidden that we don't talk about, that are being placed on the insurance companies, it is going on all of us honest people who try to drive under 70, sometimes a little faster, but do not run into other people and manage ourselves on the highways and manage our homes. So I mean, it really starts to get to me. So do other states assess the domestic insurers like Connecticut?
Yes, it is very typical for other states to have the insurance departments assessed to pay for the operations of the insurance department by the carriers, by your domestic carriers. However, I'm not aware of other states that have different programs put into the insurance fund. That I'm not aware of. It might happen, Representative Walker, but I'm not aware of it. And by the way, also, let me take the opportunity. We do not object to our assessment in terms of what we do to pay for the insurance department. In fact, we've actually had conversations with folks that if we could get the insurance department fully staffed, we would consider higher assessments because it's paramount to us that the insurance department is fully staffed. They're doing a fantastic job, but they need to approve our products and deal with all of our filings. It is incumbent upon us to make sure that our insurance department is funded at its appropriate level and staffed at its appropriate level. So I don't want anyone to think that we object to that. Absolutely not. It's just we think that if you're going to have public health related offices, they shouldn't be borne by life, home, and auto.
Thank you. Thank you. Thank you, Madam Chair.
Thank you. Representative Paris?
Thank you, Madam Chair. I appreciate it. I also, Eric, I join in the chorus that Representative Walker has just shared. I keep adding things to my insurance policy that I've had with the same company for the last 10, 12 years, and things keep going up in terms of its rates. And when I ask for an explanation in terms of why the term of my policy payment keeps going up, it's simply because of the state of where we are with the insurance world in Connecticut in general and across the country. So I might have to go buy something big and get that insured and see if that takes me down a little bit, but I'm sure it won't. But as we're trying to fix the budget, and we understand that this is an adjustment year, and we're trying to look for ways to be cost neutral and cost effective for Connecticut residents, a good way for us to try to keep some money in their pockets is to ensure that we're not adding more of a burden to them. So this bill, essentially, I know that you've said it once, but for clarification, this bill would be revenue neutral. Is that correct?
That is correct, Representative Paris.
And that impact we wouldn't even see an impact in future bienniums moving forward. Is that right as well?
That is correct. Under 372, you would not.
Just one more question for you. Now, it seems to me that every 5 to 10 years, we come up with these new assessments and we throw in what should be considered in this assessment. Are we, I guess, concerned about this assessment coming up again in the future? Because if that is the case, if we're going to throw more things in terms of what should be assessed with some of the policies that we have, I think it may be on the safer side of things to have in statute for us to look for ways to ensure that some of these protections or our favorite word this year, guardrails, are set in place in order for us to ensure that this isn't a continuous burden for Connecticut residents. Would you agree?
I would, Representative Paris, and you know, I would encourage you and this committee to, when you look at the insurance fund and you see the different programs that are included in it, I would give strong consideration, and I'm confident that my friend Susan Halpin would agree with me on this, to including those back into the general fund, that they should be direct appropriations from the general fund and not placed into a fund like the insurance fund.
Perfect. Thank you so much, Madam Chair. Thank you.
Thank you. Are there any other comments or questions? Seeing none, you are all set.
Thank you so much.
Up next is Jocelyn Delancey.
Good afternoon. My name is Jocelyn Delancey. I'm the Vice President of the Connecticut Education Association. I represent over 40,000 active retired and aspiring educators. We submitted written testimony on a number of issues, but I really want to speak directly to the provision in SB 50 to exclude statutory grants to distressed municipalities from calculations of the state's funding cap. We understand the intentions behind the funding cap, the caps, but unfortunately for our distressed municipalities and our school districts, this comes with arbitrary barriers. I have the benefit of working for a very affluent school district that's very well funded, and I understand the benefits to having smaller class sizes and highly compensated educators and staff. And when we aren't able to fully fund our distressed municipalities at that same level, we really see how that impacts our students. With the work that we're doing in the state to work with disconnected youth and to really look at the literacy issues in our districts and our schools, we really hope to see that this cap doesn't impact our distressed municipalities when it comes to impacting our school districts and doing the best that we can to make sure all students in the state are getting what they need. I'm sitting in one of the Darien schools right now, and it's beautiful. The class sizes are small and our students are doing such great work. But I think when schools can't fully fund the work that they want to do, not because they don't want to, not because they don't want to prioritize it, but because the funds aren't there, we really need to look to the state to support that and show that the priority is to invest in our public schools. And I also think when we have these caps and we don't support our public schools in this way, our distressed municipalities, it sets a lower bar for our highly funded districts to make sure that they're prioritizing in the same way. So I'm hoping that we look to this, we support the provision, and we look forward to seeing what we can do to really empower our public schools and ensure that our students, that they are our top priority. Thank you.
Thank you. Jocelyn, are you aware of the fact that moving out the distressed municipalities rebases, that does not leave us any room under the general fund for increased general fund expenditures? And again, even having those outside there would require us to have a conversation with the administration to add any additional funding into distressed municipalities. And many distressed municipalities would not increase the educational funding because they are so underfunded relative to town government and doing anything, that this may not have the impact. You're assuming, and everybody that's come and talked about this is assuming that we're going to put more funding into education. That is not necessarily true. The education ECS formula would not change, and it would not see an increase in general fund expenditures, other expenditures into education. Distressed municipalities are not always an alliance district, are not always a priority school district. So any new funding that would go in may not go into where everybody is pre-assuming that that is going to happen. So I just want to make sure they understand that we would have to rebase, we would lose money in the general fund, we would move it out here, and then we would have a different fight relative to funding. And because we don't add in additional funding relative to education, other than the ECS formula, which would remain under the general fund budget, we may not see that happen. So I think that there's a misunderstanding in how the process works relative to funding schools and the difference between a distressed municipality, an alliance school district, a priority school district, and how that funding is done. And all of the other funding remains, even the alliance school districts are under the ECS formula. So that would not be moved out into another area. So I just want to make sure that people are paying attention to the fact that this is not a way to get more education funding if that's the intention. If we move distressed municipalities out, that would be general government for that municipality that would be looking at. It would not be funding for schools.
I appreciate that. And I think what we're really concerned about is because the caps are there, when there is money to be shared and there are barriers to being able to provide that money. I happen to live in a district that is an alliance district, but I don't believe it's a distressed municipality. And unfortunately, I think sometimes that funding that should be going into the public school system is prioritized elsewhere. And I think when we have these caps, it kind of sets a standard to say, the money shouldn't be going into our public system of our public schools to support those issues. And I think the investment in supporting our most distressed municipalities in fixing the public school issues would come back in leaps and bounds in terms of the investment and what it would provide for that community when we're looking at people who are looking to buy real estate and go into a city or a town and want to look to the public school system and look at a town or city like Bridgeport and go, oh, my class size is going to be 28. If they have the choice of where to live, they probably won't look to that, So I think that when we're seeing some of these municipalities in crisis in terms of their school systems, being able to flexibly provide the financial support is important to us. And we just want to make sure that you understand that sometimes we think that there's a need and there's money, but the barriers don't always allow for us to get that money where the need is.
Right, but moving distressed municipalities in particular does not change education funding. Education funding would still remain in the general fund. It would not be moved outside the cap. That's completely an erroneous statement. Even the young people that were here earlier were talking about more education funding, which is different than distressed municipalities funding. I represent 4 distressed municipalities, and fully half of the distressed municipalities are on the 395 corridor, all old mill towns, all with significant problems. Some of them have alliance districts, but some do not. A distressed municipality is just different. So I just want to make sure you understand that.
Thank you.
Representative Johnson.
Thank you so much, Madam Chair, and thank you so much for your testimony today and for look for the flexibility that we need to make sure that education, that the distressed municipalities will have a more chance to have equality throughout the state of Connecticut. We've had a system that has really oppressed our distressed municipalities, and many of the distressed municipalities provide services to the region that the region never ever hosts. For example, many distressed municipalities have homeless shelters. They have more public housing on a per capita basis that does not receive any payment in lieu of taxes because it's state subsidized housing. So there's a number of things that our distressed municipalities serve. So I like to refer to many of them as the serving communities. They provide the services and they don't get reimbursed for the services. And they've been doing this for years. And putting a cap on things like we have been doing limits access to resources. So if you're in a distressed municipality.
Representative Johnson, do you have a question?
I do in a moment, Madam Chair.
Good.
Thank you.
All right, let's move it along.
Thank you. Yes. So if you have a distressed municipality that, for example, has budget referendums every single time and your education is voted down, then that will actually have an impact on the students. And I just wondered if you had any comments regarding the distressed municipalities that serve the region and provide services that are not provided by the region, like homeless shelters, like subsidized housing, those kinds of things.
So I would say that I think all of those services impact how we are able to educate some of the students that come from those services. And so I think being able to fund those appropriately is very important. What we see in all of our municipalities, not just our distressed ones, is that we have districts that the boards of finance and the town councils make very clear statements about how much funding can go to the schools because they have to fund the other parts of the town and the city. And so whatever the funding the municipality gets will directly impact our education funding, even if it's not the same funding. It's all linked, and you can't rob Peter to pay Paul when it comes to a city that just has to pay for everything that they need to provide for their residents. And so I think that it's all directly linked, even if the funding isn't always it directly for one space or another. And we know that if a district can provide less in a budget increase, they can have it as little as 2% or 1% of an increase, they would do that to the school districts. And so I think how much funding they can have impacts the dynamic approach to teaching public school in that municipality.
Thank you so much for your comments and being here today to testify. Thank you so much, Madam Chair.
All set? Thank you very much. You're all set.
Thank you.
Up next is Bill Sayers. Is Bill Sayers here? I'm looking on the computer. Up next is Costanza Segovia. Up next is Sarah Miller. Up next is Anna Batista. Up next is.
Hello.
Oh, go ahead. Anna.
Hi, good afternoon, Senator Boston, Representative Walker, and distinguished members of the Appropriations Committee. My name is Anna Batista, a recent retired Bridgeport teacher. I taught 39 years as a bilingual teacher, and lastly, talented and gifted students. In addition, I was the Bridgeport Education Association president for the last 3 years during COVID. And I speak today to lend my support to Senate Bill 377 with a specific focus on Section 5, as Pat Jordan did earlier today. This particular provision seeks to align the election schedules for all members of the Teachers Retirement Board, starting from July 2027 onward. This is important for us because right now the last two retired members of the TRB are supported, which are both supported by the Connecticut Education Association Retired and CEA, believe that we should all have the same schedule. And I also do believe in that. We shouldn't be isolating them. This proposed adjustment is clearly a necessary measure for our TRB aimed at guaranteeing that it runs smoothly and is cost effective. Thank you for listening to my testimony.
Thank you very much. Are there any comments or questions? Seeing none, you're all set. Thank you.
Thank you.
Up next is Walter Saplinski.
Good morning, Senator Austin, Representative Walker, and Appropriations distinguished members. Can you hear me?
We can. Go ahead, sir.
Okay, thank you. Thank you for the opportunity to speak with the Appropriations Committee regarding raised bill SB 377. My name is Walt Saplinski, and I'm a retired and substitute teacher for 47 years. A member who has held leadership roles in the ARTC, the CEA Retired, and the RTHA. For the record, I am opposed to raise bill SB 377, specifically 2 words in section 5 and on line 111. Those words are in July, and I fear that the impact may be overlooked. Two words can have a great impact. Think of the notable words. I do. First, two concerns. One, in July is too vague, and two, the requested change may not be legal. First, what happens in July? The words in July are too vague to encompass what is involved with the election to which those words are linked. Does in July mean the time of active voting, or does it mean the start of an election process where candidates first declare? While the focus on synchronizing elections, it does not synchronize the term start date, which remains at October 1st for two retired teacher representatives as written in this bill. Deferring to the TRB bylaws instead does not ensure a satisfactory election process. The two TRB elections held in '23 surfaced certain concerns and deficiencies, and that's why a better statutory definition is needed. Second and lastly, the intention of the words in July is to synchronize the terms of retired teacher representatives. That intention makes sense. The problem is that using the two words in July may not be legally grounded. The unstated impact of these two words will result in the state sanctioning of a term of office reduction for the two TRB retired teacher representatives duly elected under state statute PA 23-64, enacted last year and providing a full 4-year term. I cannot believe that it is permissible to reduce the term of an elected office for a person while they are serving that term. Such a retroactive action would seem to be prohibited by the ex post facto clause of the U.S. Constitution. The properly legal way to change the time length of the TRB representative terms of office is to make that change apply to the future elected holders of that office, not the current holders during their midterm. I suggest that these two words in July be deleted from this bill. The TRB can return next year with better defined language, and this hiatus is not a burden financially or otherwise because the next TRB election is not scheduled until 2027. So thank you for listening, and I'm available if there are any questions, and I always appreciate the hearing I get before the Appropriations Committee, and I thank you for the long hours that you put in. Okay.
Thank you, Mr. Saplinsky. Is there any comments or questions? Seeing none, you are all set. Thank you.
Thank you very much.
Up next is Diane Manning.
Good afternoon. I'm Diane Manning, President and CEO of United Services, which is the local mental health authority and certified community behavioral health center in the Northeast. We provide professional behavioral health treatment and support services to more than 5,000 individuals and their families and communities each year. Thank you for the opportunity to testify on SB 50. The proposal would create capacity under the spending cap to appropriately fund vital services provided by community nonprofits for some of the most vulnerable residents of our state. While I appreciate the increases the legislature has provided over the last few years, they've not been enough to meet the needs of the people we serve and the increase in demand. Each year, we're told there's no room under the spending cap because of fixed expenses. While our clients and services appear under this answer to be discretionary, I can assure you they are life-saving for the people we serve. We employ professionals who are committed to providing services that save people's lives. However, we cannot provide the services that are needed because we cannot hire and keep staff to meet the increases in need we see every day. Everything we as an organization need to operate, staff, benefits, utilities, transportation, supplies, has increased at no less than the rate of inflation. The same increases impact our staff. They need to make decisions about whether they can stay on jobs they love or pay their own bills, including the cost of student loan repayment. Many are forced to leave the field or go into jobs that pay more in the private or state sector so they can take care of their families and themselves. The behavioral health needs of the state are growing and demand for our services has increased dramatically, but we can't meet the need without increased funding. This proposal will allow the state to invest in the services that would keep people safe and functional in the community. Please use the proposal in this bill to provide funding to increase support for vital services. Thank you.
Thank you very much, Diane. Appreciate your comments. And you had brought another issue to the attention of myself and my co-chair, and we are looking at that and having a meeting, setting up with Demas next week to talk about the change in formula that they had put in there. And so I just wanted to let you know where we stand right now on that.
Thank you very much for your support on that.
Okay, we will talk soon. Anybody have any comments or questions? Of course, Representative Johnson.
Thank you so much, Diane. I really appreciate your testimony today. And I didn't know whether or not you would have any remarks regarding how the Medicaid program splits everything up into 3 different parts. And we're in Eastern Connecticut, so we're in Section C, and we get the lowest rates of reimbursement.
We do, and the rates in general are significantly lower than the benchmarks that were identified in the Medicaid rate study. So every time those rates spread farther and farther from cost, the amount that we can provide as far as services in the community gets smaller and smaller.
Thank you so much for that. And I watch it every day, and I appreciate your work very much. Thank you, Madam Chair.
Thank you. Any other comments or questions? Seeing none. Thank you, Diane. Up next is Darrell Johnson. Mr. Johnson, are you here?
Yes, I am. Good afternoon, Senator Austin, Representative Walker, and members of the committee. My name is Darrell Johnson. I am legislative representative for Local 1 of the Association of Commuter Rail Employees, or ACRE for short. You have my written testimony there, but I think I'll skim through it and summarize it here in person. Our members of ACRE include conductors, engineers, power supervisors, rail traffic controllers, signalmen, and assistant station masters on Metro North Railroad. Our goal is to get our passengers to and from their destinations safely and as close to on time as possible. We want to express our strong support for House Bill 5006, an act restoring funding to the Shoreline East Rail Line. We hope that your committee can provide the resources that will enable DOT to return service levels to what they were prior to the start of the pandemic in 2020. Our members truly appreciate your commitment to commuter rail funding. Last year, we saw the potential for significant cuts to service levels on the New Haven line. However, stakeholders worked together to mitigate and reduce these cuts as much as possible. Reduced or spotty service on Shoreline East causes a lack of connectivity to other trains in New Haven, which incents travelers to just get to their destination by driving. We truly believe that if service levels return to 100%, you will see many more passengers use Shoreline East. More passengers means more fare dollars collected, with the extra revenue reducing the need for our subsidies. Although it has taken some time, the New Haven line has been moving up toward full service, and commuters have responded nicely. Our conductors can attest that the trains are very full at many points in a typical day. People are returning to their offices, and they're returning to the trains as well. And let's just keep the progress going there. We believe that an effective transportation system with a fully funded commuter rail component that provides safe, on-time, reliable, and frequent service is a sound investment for the people of Connecticut. Thank you for hearing our thoughts on this bill and for your commitment to commuter rail in Connecticut.
Well, we really appreciate you testifying on Shoreline East. We think it's important that we have good public transportation across the state. So thank you very much. Are there any questions or comments for Mr. Johnson? Thank you, sir. You're all set.
Thank you, Madam Chair.
Thank you very much. Leslie Lateau.
Yes, hello. Good afternoon,
yours.
Senator Austin, Representative Walker, and members of the Appropriation Committee. Thanks for the opportunity to testify today. Can you hear me?
Yes, we can.
Great,
Go ahead.
thank you. I'm a teacher and parent in New Haven Public Schools and a New Haven resident. I'm the president of New Haven Federation of Teachers, Pre-K-12 Divisional Vice President for AFT Connecticut, Executive Board Member of CT AFL-CIO, and a member of the Connecticut for All Coalition. I'm writing in support of SB 50 to adjust the spending cap and allow more aid to distressed municipalities. The large majority of Connecticut residents need transformative investments into our public services and institutions in order to come out of survival mode and thrive. We understand the importance of paying our debts and planning for a sustainable future, but there must be a balance. The legislator must be open to modifying the fiscal guardrails and to passing revenue policies that can help our communities. So often our public schools are looked to as a panacea to solve so many of the social and economic problems caused by persistent economic equality, unfair tax structures, and underfunded programs in our state. And while as a teacher and a mom of a public school student, I absolutely believe in the power of public education to support students and families as they work to build and follow their dreams, I also know that we must do this work in partnership with a wide range of organizations that are part of the social safety net that is part of any well-functioning democratic society. We need a more robust and comprehensive social safety net in our state as our residents endure some of the worst racial, economic, and gender inequities in the country. Connecticut's wealth gap is not only large, but persistent, and it continues to widen. We need solutions for the 881,000 families in our state with an annual income of $21,000. We're the third richest state per capita, and we have the 7th highest poverty rate in the nation. We must work to create targeted policies that address the poverty so many residents, specifically the children in our schools, experience. By enacting SB 50, we can create space under the spending cap that would allow us to be able to spend more in the greatest areas of need. Spending for distressed municipalities has historically been outside of the spending cap, allowing for more flexibility. In 2017, funding for distressed municipalities was placed under the spending cap and fiscal guardrails were enacted. Previous to that, funding was outside the spending cap, and those grants went to school-based health centers, teen pregnancy prevention, bilingual education, and other important programs. Again, as a teacher, a union leader, a former outreach worker with student parents in New Haven, I know how much impact these grants have on our city and others throughout the state. Rigid adherence to the fiscal guardrails are preventing us from changing the future for our most vulnerable residents. Let's enact SB 50 to create a prosperous future for all of Connecticut's residents, especially in our urban centers and rural communities where the need is the highest. Thank you again for the opportunity to testify.
Thank you. Any comments or questions? Seeing none. It's the same question or comment, Susan?
No, just saying thank you for your testimony and thank you for taking the time to be with us today.
Yes, thank you.
Thank you. Anybody else? Seeing none? You're all set. Thanks, Leslie. Up next is Samuel Gold. Samuel Gold.
Good afternoon. Good afternoon, co-chairs Austin and Walker, ranking members, and esteemed members of the Appropriations Committee. I'd like to thank the committee for this opportunity to speak in support of House Bill 5004, an act restoring service on the Shoreline East Rail Line. My name is Samuel Gold. I am the Executive Director of RiverCog, the Lower Connecticut River Valley Council of Governments. We are the Metropolitan Planning Organization for 3 Shoreline East station towns, Clinton, Westbrook, and Old Saybrook. As you know, Shoreline East service has been slashed. These cuts have occurred while service on other commuter rail lines, such as the Waterway branch of Metro North, have been heavily invested in. The situation is clear. If you make transit more frequent, it becomes easier to use and more people will use it. We've seen this on the Waterway branch where they've exceeded pre-COVID ridership numbers. If you can't get home to get to work or get home on transit, that trip will not be made on transit. The relationship between the number of runs of a transit line and ridership is not linear, particularly when service is cut and becomes much less useful. When transit is disrupted, as was the case right before COVID with the Amtrak ballast undercutting project, and then 2 rounds of service cuts during COVID, riders stop using the service. No other rail line in Connecticut has suffered as much as Shoreline East, and then has been blamed for the resulting drop in ridership. While service has been cut on Shoreline East, there have been a number of significant investments, including a new train station in Clinton and new electric M8 cars. Amtrak is investing nearly $1 billion in a new rail bridge over the Connecticut River, which will increase train speeds and rail capacity. And a 2023 Condot study found demand for expanded rail services in southeastern Connecticut. RiverCog and our member municipalities are nevertheless taking transit-oriented development seriously. RiverCog completed a regional housing plan, along with municipal affordable housing plans for each member municipality in 2022. Transit-oriented development is a major recommendation of the plans. And last year, RiverCog was Connecticut's only recipient of a Thriving Communities grant from USDOT. This federal discretionary grant is paying for the creation of transit-oriented development plans around our 3 Shoreline East stations. These plans will support TOD around our stations, but only if there's sufficient train service. Importantly, a major component of our TOD plans are wastewater engineering studies to figure out how to accommodate density around our train stations along the shoreline where there's no sewer. We're also excited by the recent proposal for over a $400 million development in Westbrook within walking distance of the Shoreline East station. Finally, I'd like to request that when rail service is cut, the alternate options be found for those passengers, particularly through replacement express bus service. Generally, the cost of operating a bus is far less than a train, and although buses get stuck in the same I-95 traffic that many seek to avoid, at least it provides a viable option for people. Today, if you were to attempt to make one of the canceled Shoreline East trips between New London and New Haven by local bus, it would take you about 3 hours on 3 buses with 2 transfers. This is not a trip that most people can take. When Condot held its service cut hearings, I connected Estuary Transit District with Connecticut DOT rail staff. Unfortunately, a replacement express bus was not pursued. Overall, this session, as was the case in previous years, there are a number of bills that throw around the term transit-oriented development and positioning it as a solution to many of the state's housing issues. But I shouldn't have to remind you or any legislator that you can't have TOD without robust investment in T. Transit must come first. Thank you very much.
Thank you very much. Are there any comments or questions? Seeing none, you're all set, Sam. Thanks.
Yeah, thank you.
Up next is Susan Fiester.
Good afternoon.
Go ahead.
Yes, to the Honorable Chair, Co-Chair Senator Catherine Austin, Rep. Tony Walker, and all distinguished members of the Appropriations Committee. My name is Susan Fiester, and I am the founder of the Shoreline East Riders Advocacy Group. I am offering testimony in support of HB 5006, an actor store service on the Shoreline East rail line. If you do not live on the shoreline east of New Haven, you cannot understand what the Shoreline East riders have endured over the years. At this point in time, Shoreline East has a target on its back, and Governor Lamont has taken aim. No other rail line has been scrutinized as much as Shoreline East has. Do you really think that riders will ride a train that offers such a limited schedule? Would you? Do you know that the Waterbury line is funded at 135%, while Shoreline East was gutted to 44%? DOT Commissioner Ucalito spoke at the transportation hearing on March 4th, stating, quote, that the people who live on the shoreline are working more remotely now. I'm not sure if I missed that memo, but can Commissioner Ucalito tell me when he took that poll and where the results can be found? When legislators recently brought forward House Bill 5389 to call back certain state employees to the office, one can deduce that other public entities will follow, further solidifying the need for more trains. I speak to people every day that ride Shoreline East and those who wish they could, but cannot because there are not enough trains. One Southern student had to quit college because she is physically impaired and cannot drive, and the drastically reduced schedule made her day physically impossible. I commute with someone who lives in Griswold and several others who used to take the Stamford through train. Now, they drive to West Haven to pick up the train to Stamford. Here are some hard facts supporting the Stamford train. In July 2023, there were 8,500 tickets purchased via ticket vending machines in the Connecticut RailTick app. 40% of those tickets, roughly 3,400, shared a transaction number with the New Haven line. 2,800 had a destination of Grand Central, 150 for 125th Street, 34 for Fordham Station, 90 for Stamford, and 135 for Bridgeport Station. These are clear, hard numbers that prove that we need the Stamford train, and we need additional funding to make that happen. This is not the unsubstantiated conjecture that Governor Lamont and Commissioner Euclid are espousing, but hard facts. The State Street Station has a message board that loops through several inspiring transportation messages, such as a greener way to travel and bypassing traffic, all emblazoned with the Hartford Line logo. Let's rewrite those for Shoreline East, the high carbon footprint way to travel and not bypassing traffic. I have worked tirelessly for years advocating for those who use and wish to use the Shoreline East trains. I am learning that funding is mostly political, which is very disheartening. Legislators speak at events in their districts and committee hearings saying that they support Shoreline East, which their constituents believe, but then vote for a budget that guts the train line. When money can be found year after year for everything else, please stand up collectively and show us your support by funding Shoreline East. Thank you.
Thank you very much. Up next is Jen Kowecki. Jen, number 36.
Yes. Hi, Senator Austin, Representative Walker, and members of the committee. My name is Jen Kowecki. I'm the Executive Director of the Connecticut Marine Trades Association. I'm representing CMTA today to offer comments on House Bill 5047, an act implementing the governor's recommendations for general government. I will confine my comments to provisions relating to the Connecticut Port Authority. At the conclusion of my statement is an update on the issue of dredging. Right now, the Connecticut Port Authority serves as the main conduit to the state's maritime economy and commerce. The recreational boating sector, with our marinas and water-dependent businesses, is a significant part of that. Subsuming the CPA into the Connecticut Airport Authority could lose that laser focus. The Connecticut Airport Authority's Executive Director and Board of Directors would oversee a renamed Connecticut Maritime Authority. We wonder if that really would make sense. They already have major responsibilities for ensuring the safe and cost-effective operation of Bradley International Airport and 5 general aviation airports. Foisting a new portfolio of maritime commerce upon them seems to be inappropriate. The Connecticut Port Authority has been designated a lead entity to develop a plan with the U.S. Army Corps of Engineers to enable dredging in our waterways, harbors, and marinas. Without dredging, the maritime economy would come to a screeching halt. This is not the time to turn this vital matter over to an entity that has little or no interest or expertise in it. For these reasons and others, the Connecticut Marine Trades Association would ask that you keep the Connecticut Port Authority where it is right now as a standalone entity. Our maritime economy will benefit as a result. Thank you.
Thank you very much, Jen. I have a couple questions for you. One of the things that I have noticed, and some of my colleagues in Eastern Connecticut have noticed for the Port Authority, that there has not been significant or any real marketing of the small harbors and marinas that are around the state. And that is part of the Port Authority's responsibility. That's my question number one, because I know that the Marine Trades Association was also concerned about the fact that ship grants had not been going out. The small harbor improvement plans programs have not been going out. They're supposed to, by state law, go out every year on a competitive basis with $5 million, and have only seen 3 rounds completed. So where does the Marine Trades Association think we should improve both the marketing and the requirement by law of the what the Port Authority is supposed to be doing?
So let's take the marketing. Where do we feel that they can improve the marketing of these grants? First of all, just through communication, it needs to get out there that these grants are actually available. When we have grants, we work closely with DEEP, and those grants, when they are up for it's time to apply, we do send those out to all of our members. So just being a better open communication with the Connecticut Port Authority, sharing what grants are available, for everyone in the industry to take advantage of. So communication, first of all. The second question that you had was, I'm sorry, could you repeat the second part of that?
So I understand the marketing on the grant
Right.
systems, but they're actually supposed to be the Port Authority is supposed to be marketing all of our, not just our deep water ports, but all of our ports, our small harbors and our marinas. They're not isolated into just doing the deep water ports, the Bridgeport, New Haven and New
Right.
London. They're supposed to be doing maritime broadly, not just that. And I haven't seen them really step into that at all, marketing that piece. Relative to the ship grants, those are supposed to be done every single year and have only been done 3 out of the last 10 years, although they do have one that's posted now. So how do we get the Port Authority to do all of its role and not just a part of its role?
Well, that's a very good question. Oversight, I honestly, they need to do better at managing what is on their plate. And I think if it were to be put under the authority of the airport authority, then it would probably be even less. Because it would be merged in with an organization that doesn't have the expertise or the knowledge to take over and to actually improve what the Connecticut Port Authority is supposed to be handling. So standing alone on its own as it has been, however, there needs to be more responsibility. They need to handle their responsibility a little bit more. And again, combining them with the airport authority, I think would take away from their responsibilities.
And if we didn't put them under the airport authority that the governor is requesting, would you be in favor of us moving the small harbors and marinas back under the auspices of the Department of Transportation, as some of the delegation has attempted to do, to make sure that we're seeing real marketing done on an industry that provides billions of dollars to the state in revenue? And would you see that as another way that this could be handled?
That is definitely something that the board can discuss. It sounds like a great idea, but that is something that is definitely up for a discussion. Absolutely.
And then you said you were going to talk a little bit about dredging, and that's another area that we have fallen far short of what we were doing prior to the Port Authority taking over dredging. We have a dredging study that the legislature paid for that is supposed to be looking at ways to handle dredge spoils, looking at a real plan on dredging, in particular, the small harbors and the marinas, because we don't have to worry about the mouth of the Thames because of national security. And
correct.
That's directly reflective of the subbase and electric boat. But where do you stand on the dredging, the lack of real of the responsibility of the Port Authority to handle dredging?
Well, right now, all of that information is in the update and that we're working towards a comprehensive solution. The Port Authority is actually an important part of it. They are working, they have signed a memorandum of understanding with the U.S. Army Corps of Engineers for the critical review of dredging needs in our state. 1/2 of the 1.5 million cost that is being paid by the state. This needs assessment is important as it will quantify what the aggregate dredging needs are, but will show us for the small marina sector. We've seen state agencies communicating with one another on this end, and the Department of Energy, Environmental Protection, deep with their counterparts in New York and Rhode Island. A significant development was the Rosado decision in September of 2022 by the Second Circuit Court of Appeals. They upheld the process which established the Eastern Long Island disposal site to take the dredged materials. This is located 2.5 miles south of Groton.
For years, though, New York State was stopping the process cold by objecting to any permits that would use ELDS. On the day of the decision, Congressman Courtney said it best, it's time for all parties to get out of the courthouse and work together to implement the disposal plan. The key issue with dredging will be if New York allows permits to go forward. So far, we are aware of a large dredging project that has received preliminary clearance from the United States Army Corps to dredge using ELDS. We're still waiting to see how this will all shake out and how it will end, if in fact it will be able to go through. We appreciate all of the interest that you have done helping us with dredging, but we are far from even seeing the finish line with it.
I agree, and I am very concerned about the fact that we're not completing dredging as we should be completing. Representative Walker and I put the money in the budget 2 years ago, and we have seen little movement by the Port Authority to address this issue. Although they did sign the memorandum of agreement, the fact that New York continues to say that they will not sign off on all permits. And we all know that the national security issue in the Thames River will be done whether New York approves it or not. So the large dredging projects, we are not worried about because that will happen. But the smaller dredging projects that need to get done for economic means of our marinas and our harbors has to get done. And the reason why New York was not allowing these permits was because the state had not done a true dredging study. That's what the money is there for. $3 million was put there 2 years ago, and it took us 2 years just to get the agreement signed with the Army Corps. We have real reason to be concerned on the effectiveness of the Port Authority in getting projects done. We'll have another meeting coming up on dredging shortly, but we have been having meetings every 6 weeks on this issue for 2 years to get this far. And it's not, it is putting at risk both the funding and the actual results of getting dredging completed in our state, which needs to happen.
Absolutely. When Governor Lamont visited a marina in Mystic with us this past summer, he publicly stated that dredging is important to our small family-owned marinas and the broader economy of southeastern Connecticut. And that is exactly what it is. Dredging needs to happen across the state. These are small businesses. These are families. It's their employees. If we can't get the dredging done, it affects all of them not being able to make a living.
And that's why we need to put the SHIP grants out there.
100%.
All right, thank you.
Thank you very much.
I think there are a couple people that have questions. Representative McCarty.
Just very quickly, thank you, Madam Chairman. I'm just curious, I appreciate your testimony, but could you just say, so if the Connecticut Port Authority is subsumed under the Airport Authority, do you think it's going to have effects on moving the dredging that we just highlighted going forward? Can you specify that? And then has the marine trades, have they had direct conversations with the Airport Authority?
To begin your first question, yes, I do think it will affect the ability to move the dredging forward. It's taking an organization that clearly needs to have a little bit more, lack of better terms, oomph put into it. And now you're going to be adding it into another association organization that really is just taking it in. It's not going to nurture and foster what actually needs to happen regarding dredging. Dredging is a very far cry from airport comings and goings. We need it. The Connecticut Port Authority needs to stay in a standalone so they can foster the dredging for the state of Connecticut. And then your second question was, I'm sorry, I can't remember what your second question was. Sorry.
Well, You answered it.
Okay, great.
Just concerned.
I thought I did, yes.
Well, the other piece to it was, have you
Have we had conversations?
with the airport authority?
No, we have not.
Okay, because that would be, I'd be of interest to see what their response would be to some of your concerns. But I appreciate you
Yes,
coming
for that.
forward today and giving your testimony.
Sure. Thank you for your time.
Thank you. Any other questions? Nope. Thank you very much. Have a good afternoon.
Thank you. You as well.
Thanks. Next, Colleen Ezo. Colleen. Let's see her. Okay. Jim Pereira.
Hello.
Hi there. Go right ahead, sir.
Thank you very much. Hello, Chairpersons Austin and Walker, distinguished members of the Appropriations Committee. Thank you for the opportunity to provide testimony in support of Senate Bill 1, an act concerning funding for a pre-apprenticeship grant program. My name is Jim Paris. I'm the CEO of the Home Builders and Remodelers Association of Connecticut, and we represent over 800 businesses engaged in the residential construction industry statewide. You have my written testimony, so I'll be very brief. I heard Senator Austin this morning talk about Electric Boat hiring 5,000 employees when speaking to the need for Shoreline East funding. I think it's worth noting that additional challenges to Electric Boat's hiring efforts include the lack of sufficient housing production to meet the needs in Eastern Connecticut. While there are a number of factors contributing to an insufficient housing stock and slow housing production in Connecticut, one of the significant factors is the lack of skilled labor in our industry. Anecdotally, I was at an event last night where the National Association of Home Builders chief economist was giving a presentation, and he highlighted the national annual survey of builders that's done by the NAHB, and it identified the availability of labor as their single most significant problem faced by the builder community. Senate Bill 51 would be a small but important step towards addressing our skilled labor shortage in Connecticut by providing $1,000 grants to schools who give students that successfully complete a Connecticut Department of Labor certified pre-apprenticeship program. This program is modeled after an extremely successful program in Colorado, which has seen 44,000 Colorado students complete pre-apprenticeship programs since 2016. The licensed trades are a rewarding career and a great option with great compensation for young kids to consider. It has some of the best entrepreneurial opportunities of any industry, and the HBRA strongly supports the committee or urges the committee to pass Senate Bill 51 and provide the necessary funding to get the pre-apprenticeship grant program off the ground. Thank you.
Thank you, and thank you for your testimony. Are there any questions? If not, thank you. Have a great afternoon.
Thank you very much.
Jim Gildy? Next Betsy Gara?
Thank you. Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio. My name is Betsy Gare. I'm the Executive Director of the Connecticut Council of Small Towns, and I will just briefly share my comments in strong support of Section 15 of House Bill 5047, which simply increases the maximum grant available under the Small Town Economic Assistance Program from $500,000 to $1 million. COST was instrumental in supporting the creation of the program back in 2001. The cap has been in place since then, and certainly given increases in construction costs, et cetera, it's time to increase that cap and make sure that this program can be used by our small towns to continue to support community and economic development projects in their municipality that can address some of the needs of our residents and local businesses. Thank you.
Thank you. Are there any questions? Thank you and have a good day.
Thank you.
Next, Tom Lodato. Tom, I saw you. Didn't I? I'm sorry. Okay. I'm going to go back up to number 42, Jim Gilda. Good
Good
afternoon.
afternoon, Representative Walker, Senator Austin, and members of the Appropriations Committee. I appreciate the opportunity to speak today in behalf of 5006, an act restoring funding to Shoreline East Rail Line. I am the chairman of the Connecticut Public Transportation Council. I will tell you, I believe strongly, and I think every evidence suggests that service builds ridership. It does not work the other way around. I think the Waterbury branch, of which I am a commuter and a user, is perfect testament of this. The Waterbury branch was given 44% increase in service, and it is the only branch in the state of Connecticut. I want to say that again. It is the only branch in the state of Connecticut that has exceeded its pre-COVID ridership. Another thing, and I really think if there's any one message I could leave here today, is this. I am an advocate for all rail lines. I'm an advocate for all public transportation. I believe having a public transportation line that is second to none is a key to a vibrant economy. So please, with that as a backdrop, recognizing that I support all public transportation, I will tell you that the ridership metrics that we often get quoted of why they cut Shoreline East are arbitrary, they're meaningless, and they just use those to justify that why they have cut the line. The Danbury branch ended the calendar year 2023 with 45% of their pre-COVID ridership. The New Canaan line ended the year with 55% of their pre-COVID ridership, and yet those lines are slated, have been at 100%, and are slated to get 100% service again. And I am an advocate for that. That is great. But however, it is so random and arbitrary that we continue to hold the Shoreline East to ridership metrics that we do nowhere else in the state of Connecticut. So I do think that to some degree there is an Eastern Connecticut bias. I can't put my finger on it. But again, that is key, recognizing that the Shoreline East is the only branch that has these arbitrary metrics that they need. The Shoreline East was once a proud and vibrant rail line. You go back to 2018, pre-COVID, it was as strong as any other branch. However, they simply were not given the opportunity to build ridership like everywhere else. So with that, I testify in strong support of 5006 and hope you will consider providing the funding that rail line needs to be the vibrant line it once was. Thank you.
Thank you, and thank you for your testimony. Are there any questions? All right. Thank you, and have a good afternoon.
Take care.
Next, Tom, it's your turn.
Thank you, and good afternoon, members of the Appropriation Committee. Thank you for this opportunity. My name is Tom Laudadio, and I'm the Vice President of Education at the Children's Center of Hamden. The Children's Center of Hamden strongly opposes Section 1, lines 7 through 9, and lines 23 through 24 of the Senate Bill 377. The Children's Center of Hamden is the first agency chartered by the state of Connecticut for the care of dependent children. We were founded in 1833 as a New Haven orphan asylum. Our agency has been devoted to serving the physical, emotional, and educational needs of vulnerable and at-risk children for over 185 years. Currently, we offer a full array of treatment services nationally accredited by the Joint Commission. We serve approximately 500 youth and families each year. At the central component of our service continuum is a state-approved special education school, Whitney Hall School. Whitney Hall provides specialized academic instruction to youth who require 24-hour care at our facility, and also those referred by the local public schools when the highly specialized need of a student is beyond the capacity of the school district. For over 50 years, our certified staff have participated in the Connecticut Teachers Retirement Program. Currently, we employ 48 full-time and per diem staff. Of the 48, 12 of our staff actively participate in the Connecticut Teachers Retirement Program. The ability of our school staff to take advantage of this benefit has been a crucial part of attracting and maintaining qualified employees. The Children's Center successfully educates extremely challenging students because we have a competent team of educators. As a nonprofit school, I'm sure you are aware that our salaries fall far below that of public school salaries. To eliminate our certified educators to participate in the state teachers retirement system will limit our ability to attract and, more importantly, maintain the quality and expertise we desperately need to meet the needs of our disabled students. The ability of our educators to participate in the teacher retirement system has allowed our teachers to maintain a career with us at our school and also invest in our mission to provide care and education to some of Connecticut's most vulnerable and traumatized children and adolescents. Thank you again for the opportunity. I just want to say that I believe the change would seriously jeopardize our school's capacity to fulfill its mission, and respectfully request that you delete all that pertains to the Children's Center in lines 7 through 9 and 23 through 24 from Senate Bill number 377. Thank you.
Thank you, and thank you for your testimony. Are there any questions? Thank you very much. Thank you, and have a good afternoon.
Thank you.
Next, Savon Warren. Oh, good. Okay. Next, Christopher Trombley. I know I saw him. I thought, there we go. There we go.
Here I am. I'm back like a bad penny or a bothersome rash.
That's okay. Go right ahead.
I'm Christopher Trombley. I teach educational leadership and policy studies at Southern, and I'm a member of the council of the CSU AAUP, the faculty union that represents faculty members across the 4 CSU campuses. In a letter that I posted to him just last week, I reminded Governor Lamont of St. Thomas Aquinas' observation, quote, "If the highest aim of a captain were to preserve his ship, he would keep it in port forever," end quote. It goes without saying, I wrote the governor, that sea captains must do all that they can to maintain the integrity of their ships, but in service of those vessels' larger essential missions. As with sea captains and their ships, so with elected officials and public finances. Fiscal discipline and sound bond ratings are important for Connecticut's state government to achieve, but they are not ends in themselves. Rather, they must be maintained in order that our state government may fulfill its larger essential mission, which, to quote from our state's constitution, is to perpetuate the liberties, rights, and privileges which the people of Connecticut have derived from their ancestors. To Connecticut's shame, the liberties, rights, and privileges about which our founders wrote so compellingly are not now being and have never been enjoyed in anything approaching a just or equitable fashion. While we happen to be among the richest states in the Union, we are also one of the least equitable. Wealth, income, and such crucial outcomes as housing security, food security, access to high-quality, affordable medical and mental health care, and free access to high-quality public education from birth to 3, pre-K through 12, and at the post-secondary level are not uniformly available to the people of our state. To your credit, the General Assembly has identified what needs to be done. Your work last year on addressing how state monies must be employed to address the gross disparities in pre-K through 12 educational opportunities available to the young people of our state is a prime example of this. Still, you all remain continually hindered in your crucial efforts by the fiscal guardrails to which this body and the administration agreed. You don't need me to remind you, although I will, that those guardrails, however prudent their aims and whatever success they have achieved, were not the product of decades of painstaking analysis by economists, accountants, and sociologists. They were arbitrarily determined during a necessarily hasty political process. Yes, the guardrails, including the spending cap, have served to raise Connecticut's esteem in the eyes of rating agencies and bondholders, but they've done nothing to ensure Connecticut's attainments of its larger essential mission, the perpetuation of the well-being of all of its residents. Still worse, the guardrails are now actively being used by people in both parties as justification for not doing more to address the hideous disparities that exist across our state, and which, we need to be honest, disproportionately impact Connecticut's people of color. I appear before you today to support SB 50, an act concerning exclusion of aid to distressed municipalities from the spending cap, a measure that, at least until I heard Senator Austin harsh my mellow earlier, I thought would very modestly but hugely importantly enhance the spending power that you all would have to provide under-resourced residents of our state with more of the liberties, rights, and privileges to which they are entitled. Chief among them, access to free, high-quality public education from birth to 3, pre-K through 12, and at the post-secondary level. But thanks so much for your time, as always.
Thank you, and thank you for your testimony. Are there any questions? Okay, next, Bill Murray. Thank you.
Been waiting for a long time. Gus has been waiting behind you.
He's proud of me. Good afternoon, Senator Austin, Representative Walker, Representative Chaleski, and the other distinguished members of the Appropriations Committee. My name is Bill Murray, and I am President of CEA Retired. I am also the former Vice Chair of the Teachers Retirement Board. I'm a retired teacher from Danbury, where I was President of the Danbury Teachers and Administrators Union. I'm here today representing 5,400 of our retired members and approximately 40,000 active teachers who are members of CEA and CEA Retired. I come before you to advocate for Senate Bill 377, specifically focusing on Section 5 of the proposal. This section proposes to synchronize the election dates for all members of the Teachers Retirement Board commencing in July 2027. The amendment is crucial following the addition of 2 new retired members to the TRB last year, a measure endorsed by both CEA Retired and CEA. This adjustment stands as a vital stride toward enhancing the efficiency and cost effectiveness of our TRB elections in 2027 and beyond. I would be negligent if I didn't add that although we supported the addition of 2 retired teachers last year, eliminating the active teachers from that vote did nothing to help the operation of the TRB. It just took away the voting rights of thousands of teachers. The Teachers Retirement Board should have mutual goals, and all elected members should be working for both active and retired teachers. Again, please support Senate Bill 377.
Thank you, sir, and thank you for your testimony. Have a good day.
Thank you.
Thank you. I'm sorry. Wait, I'm sorry. Representative Chaleski.
Thank you, Madam Chair. No, I just, sorry to have you get up and then back down again, just to say thank you for being here. I truly appreciate your input on this and other matters concerning the board. So thank you again, and please keep in touch.
I will. Thank you.
Thank you.
Have a good
Thank you,
day,
Madam
sir. Next, Norma Martinez Jose. Norma, number 48. No, okay. After that, number 49, Jim Mahfood.
Hi, good afternoon, Madam Chair and members of the committee.
Good afternoon.
My name is Jim Mahfood. I'm the CEO of the Children's Center of Hamden. We have a 190-year history of meeting unique behavioral, educational, and emotional needs of Connecticut's children and families. And on average, we employ about 200 Connecticut residents at any given time. I thank you for the opportunity to testify in opposition of SB 377, an act concerning revisions to the teachers' retirement system. Specifically, I'm in opposition of language stating employees hired after July 1, 2024 at the Children's Center will not be admitted into the state teacher retirement plan, a plan the agency has participated in for over 50 years. This bill will disrupt the agency's ability to recruit and retain certified educators. It will work against the needs of the impoverished and at-risk communities served, and work against current proposals intended to address the teacher shortage in Connecticut. As you all know, the hiring climate in Connecticut is in crisis. The nonprofit sector especially has challenges due to our inability to pay competitive wages due to years of underfunding. In the past few weeks, I know you've all heard many testimonies regarding other legislation proposed addressing remedies to those problems. This bill, specifically the much needed retirement plan benefit, the takeaway is another burden on our agency and our highly dedicated staff. Our HR department's overloaded with recruitment efforts in numerous positions. This past year, we've lost multiple staff to public schools paying $15,000 or more, and they offer the teacher's retirement. Losing the ability to offer the teacher's retirement to our recruits and our staff just puts us at a greater disadvantage in finding higher caliber educators. Earlier today, I heard the child advocate testify that Connecticut's a leader of outplacement educational services, with the majority being children of color, boys, and individuals with disabilities. That's who the center serves. We serve the outplaced children that public schools say are beyond their means, individuals in need of more focused attention from staff that are trained to handle emotional and behavioral challenges that these children bring, including being victims of trauma. Please continue to allow these dedicated teachers to benefit from participation in the teacher's pension plan. Center serves children from across the state, multiple municipalities and school districts. We believe it's in the best interest of the state, the referring districts, and the children we serve to allow the center's teachers to participate in the retirement plan, as our successful recruitment and retention of qualified and compassionate teachers helps ease the burden on all the districts and towns we serve. Without Whitney Hall School, there would be 50 students needing to be served by districts that don't have the means to serve them. Their teachers get the benefit of the teacher's retirement plan. All we're asking is that our teachers continue to participate as well. I thank you for your time, the opportunity to testify in opposition of SB 377. Especially appreciate all your efforts today and throughout the year.
Thank you, and thank you for your testimony.
Thank you.
Next, we're going to go back to number 48, Norma Martinez. Norma?
Thank you. Good afternoon, Senator Austin, Representative Walker, and members of the committee. My name is Norma Martinez-Hosang, and I'm the director of Connecticut for All. I live in Hamden. Connecticut for All's long-term vision is that every family is able to live and thrive in Connecticut. We're working to strengthen and fully fund public services. People need strong systems that support their families, like affordable and reliable childcare, strong public K-12 schools, and access to affordable healthcare. I am testifying in support of SB 50. Members of our coalition are public school students and teachers from pre-K through higher education. These public education institutions serve the future of Connecticut, and we need transformative investments in order to come out of the survival mode that many of our communities are and have the opportunity to thrive. We understand the importance of paying down our debts and planning for a sustainable future, but there is a balance that we must strike. The legislature must be open to modifying the fiscal guardrails that are currently a barrier to economic growth and social mobility, and also be open to passing revenue policies that can help our communities. Our communities are still suffering from years of disinvestment and are still living paycheck to paycheck because of the high cost of living in Connecticut. Lately, I've been hearing that Connecticut does not have a funding problem, but instead we have a spending problem because we have a surplus and a full rainy day fund. But this is not what it feels like to community members who work 2 or 3 jobs to be able to pay rent and put food at the table for their family. The rigid adherence to the fiscal guardrails are preventing us from changing the future of our state. Allowing the state to take aid to distressed municipalities outside of the spending cap, as was the case from 1991 to 2017, and to restructure the cap accordingly would create space under the spending cap that would allow us to be able to spend more in the greatest areas of need. By enacting SB 50 and other adjustments to the spending cap, we will allow the flexibility needed to significantly change the living conditions of our neighbors who are struggling the most, including the middle class. We need to be able to balance good fiscal discipline with the ability to invest where needed, especially in our urban centers and our rural communities where the need is the highest. Thank you very much for listening to my testimony today.
Thank you, and thank you for your testimony today, and have a good day. Thank you. Next, Kate Rosen.
Good afternoon,
Good
honorable
afternoon.
chairs.
Can you move closer to the mic? Because we're having a hard time hearing you.
Is that better?
It's a little bit better. A little
Okay,
bit.
I will shout. Good afternoon, honorable chair, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Kate Rosen. I am the vice chair of the Connecticut Public Transportation Council. I echo the previous comments of Jim Gilday, Zell Seaver, Darrell Johnson, Samuel Gold, Susan Feaster, and others who have testified today in support of HB 5006, an act restoring funding to the Shoreline East Rail Line. The Connecticut Public Transportation Council frequently hears from frustrated residents about cuts to service, directly impacting their ability to use the line to get to work, doctor's appointments, school, and also leisure travel within our beautiful state. The Connecticut Public Transportation Council is headed to the Shoreline East and will be meeting in person this coming Wednesday, March 20th, 2024 at 6 p.m. at the New London City Hall, Council Chambers, just 3 blocks from the Union Station. This meeting is devoted to the line and we will be receiving updates from CONDOT. In addition to this, we anticipate a presentation on the final report of the Eastern Connecticut Rail and Transit Feasibility Study, and we would be welcome to have any of you join us at that meeting. I urge the committee and the Connecticut General Assembly to support HB 5006. This is not just an investment in the Shoreline East Rail Line, but an investment in Connecticut's economic vitality, environmental health, and the quality of life of its residents. Thank you for your time and consideration.
Thank you. Thank you, and thank you for testifying today, and have a good day. Thank you. Next, we have Rose Reyes.
Thank you. Greetings, Senator Austin, Representative Walker, and esteemed members of the committee. I am Rose Reyes, an elementary school bilingual educator of over 20 years, a vice president of the Wyndham Federation of Teachers, resident of Willimantic, Connecticut, and a Working Families Party counselor on town council, and a local community and state advocate. I'm writing in support of SB 50 to adjust the spending cap and allow more aid to distressed municipalities. This legislation is evident of our leadership and could be open to modifying the fiscal guardrails that we are currently viewing as barriers to the economic growth and social mobility that we might be needing. For more than 2 decades, I've worked in this educational reference group that I lovingly call the 7 Sisters, all of which have high needs rates ranging from 82 to 91%, according to the State Department of Education. And that includes families that qualify for free reduced meals and English language learners and special education and socioeconomic status. As an educator, I learned firsthand the struggles of our working families and how our city seeks out ways to make good things happen for its residents. But we can't ignore our reality. Our poverty rate is 30% per capita with an income of $18,000. The situation is analogous to the rhyme of the ancient mariner. There's water everywhere, but nor a drop to drink. And I'm hoping that we can excise this obstacle, because here the distressed communities have done nothing wrong except be poor, right? One of the things that we ask for are not luxurious or conspicuous in consumption, but mostly to elevate the quality of life for our communities. So we need a comprehensive transportation system. By the way, thank you, Senator Austin, for workers and for visitors. And we need to employ educators to serve as our students with high needs. By enacting SB 50 and other adjustments, we can allow us to increase the funding of the very programs that help fund our community. For example, in my community, we are striving to create a comprehensive bilingual biliteracy program. We're looking to improve our roadways and our infrastructure. We just continue to need that boost. And I know that in the past, these particular grants were outside of the spending cap, and I'd like to see that we have that flexibility to alleviate the burden. So those are my remarks for the moment, and I'd be happy to entertain any questions. Thank you.
Thank you, and thank you for your testimony. Susan.
Thank you so much, Madam Chair, and thank you so much, Councilperson for Wyndham, Rose Reyes, and teacher educator. Thank you for all the good work that you do, and I really appreciate your remarks today and the fact that you took the time out of your busy schedule to provide testimony to our committee. So
Well, I appreciate the feedback. Thank you.
thank you. Take care.
Go Whippets, go Whippets.
Oh, go Whippets, yeah.
I'm sorry, I didn't realize she was from Wyndham. Sorry. Okay.
I spoke too fast.
Next, Robin Kaplan Cho.
Yes, hi. My name is Robin Kaplan Cho, and I have been a retirement specialist for the Connecticut Education Association. I'm going on my 30th year. I have the honor of representing active and retired teachers who are members of the Teachers Retirement System. I know you've heard a bit of testimony already today on the on Bill 377, the attempt to align the retirement board election, and CEA obviously supports that. I would also like to add that there is a proposal that was heard before the Education Committee that would also restore the right of active teachers to vote for those two new retired seats. And I think it's important to note that the issues that confront all members of the retirement board are not just active teachers versus retired teacher issues. They're issues that affect everyone. They vote on teachers who have active teachers who have applied for disability benefits, active teacher survivorship benefits. They vote on the valuation of the pension fund in an experience study. And those are those active teacher issues? Are they retired teacher issues? And why would we even think there's a difference? Because there's not. They're issues that all members of the board need to consider. But I'd also like to request that Bill 377 be amended to provide an increased subsidy for those teachers who are on the TRB's long-term disability. Over my 30 years at CEA, I've worked with so many teachers who are extremely ill and no longer able to work. They can apply for the TRB disability benefit, but it's based on their years of service and is capped at 50% of their salary. So for those teachers who've been teaching for 10 or even 15 years, at most their benefit will be 20 or 30% of their salary. And out of that small benefit, they also have to pay for their health insurance, which obviously for someone who's ill is a paramount issue that they need to provide for themselves. And they have the ability to remain on their district insurance at the full group rate, minus the same subsidy that is provided to retired teachers for their health insurance, which is $220 a month. But in some cases, the insurance for single coverage could be anywhere from $600 to over $1,000 a month for a single person. And that $220, while it's a help, it certainly is not enough to allow them to, in many cases, to be able to afford the insurance. And the last thing they want at that point is to have to look for new providers, which can be terrifying given the status of their health. So we're asking that the TRB's long-term disability benefit, those who are on the TRB's long-term disability benefit, be provided with a double subsidy. The same double subsidy that's provided by statute in 10-183TC for those retired teachers who will not qualify for Medicare. They get a double subsidy of $220, $440 instead of $220. I should point out that the number of retirees who don't qualify for Medicare is decreasing substantially and eventually will be zero, since all teachers since 1986 are paying the Medicare taxes. So that problem will be going away relatively soon. So we'd like that double subsidy be applied instead to those teachers who are disabled, and it will allow them to better afford their insurance as they grapple with severe physical and financial distress. Thank you very much for your time, and I'll answer any questions if you have any.
Thank you, and thank you for your testimony. There are no questions. Thank you.
Thank you.
No, thank you. Next, Jay Strange. Oh, there's no R. Okay.
It's okay, Rep. Walker. Thank you so much. People read words, not letters, and I am a little bit strange. Good afternoon, Rep. Walker and Senator Austin, distinguished Appropriations Committee members. On behalf of the Center for Latino Progress in Hartford, Connecticut, thank you for the opportunity to provide testimony in support of HB 5006, an act restoring funding to Shoreline East. The center's mission here in Hartford is to advance the socioeconomic conditions of residents in the capital region with emphasis on our Hispanic community members through education, training, youth programming, supportive services, leadership development, and advocacy. And our BCCO and Transport Hartford Academy programs work to ensure walking, bicycling, and transit opportunities are equitable, affordable, and accessible, which supplies a really critical need here in Hartford, where 1/3 of our families don't have access to a car. It's among the top 10 highest rates in the nation. Another third of families have access to a poorly working car. Our constituents have a lot in common with rural residents of Eastern Connecticut. And I mean that transportation costs are very high compared with median income in those two areas. The price of owning and operating new and used vehicles is increasing rapidly, and often academic, economic, and cultural activities that enrich our communities and our residents' lives are not available because of transportation challenges. Last year, I was struck by comments by your colleague, Senator Rahman, who testified that not having access to a car in Connecticut is like being sentenced to house arrest. Let's change that. We strongly support HB 5006, and there's not much that we can add to the excellent written testimony provided by Reps Nolan, Baumgardner, and Conley. Please, if you have a chance to review those written comments in your record, do so carefully. They're excellent comments. I'd like to take just 1 minute before I close by asking your indulgence to consider the importance of less tangible but really important value that we invest in when we invest in rail or transit in our state. We create a human infrastructure. And what I mean by that is that when we build out our public transportation, instead of leaving our residents isolated in their homes or stuck in traffic in vehicles, what we do is we encourage them to meet, to learn from each other, and to be aware of opportunities when we support rail and transit service. So operational support for public transportation is vital because it says we believe in the power of all our residents to support our families, collaborate with each other, and grow our state. Thank you so much for your time. I really appreciate the opportunity today.
Thank you. Thank you, and thank you for your testimony. Thank you. Have a good afternoon. Chris McNabo? Huh?
Good afternoon, Senator Austin, Representative Walker, Representative Johnson, and members of the Appropriations Committee. My name is Chris McNabo, CEO and founder of Horizons, one of the private nonprofit agencies providing essential services statewide to our citizens with developmental disabilities. We are beginning our 45th year. We appreciate that the proponents of SB 50 intend to expand space available under the cap, in turn creating more flexibility to fund essential nonprofit services while keeping the principles of the fiscal guardrails intact. The private sector provides 92% of community-based services for people with IDD that used to be provided by the state. We are a business, contractors of the state, not charities. We must be able to recruit and retain a professional, stable workforce. We invest over 100 hours of training in our employees. They're trained in medication administration, safely supporting people who have behavioral challenges, HIPAA compliance, person-centered program development, abuse and neglect prevention, dysphagia, and more. They are skilled professionals. We need to pay them accordingly. We also need to make capital improvements on our facilities, pay the increasing costs of fuel, energy, vehicles, insurance, and every other operating expense a business has. Budget laws can be modernized and updated to remain in place while meeting the needs of the people for whom the state programs exist. I greatly appreciate the efforts of this committee and applaud your advocacy on behalf of nonprofits. Thank you.
Thank you, and thank you very, very much for your testimony.
Chris, I just wanted to say thank you so much for your testimony and your good work in Wyndham, creating a wonderful organization that works with the developmentally disabled. So thank you so much for participating in the hearings today, and have a great afternoon. Bye-bye.
Thank you. Thank you, and have a good day. This concludes the testimonies for the public hearing we have today. Everybody have a good day. Thank you.